areas of something, or we are there. Talking and moving the there's no the issue of we are less than 40%, and I just found you that whether that environmentally important for that whether there are staff but paying and you understand what it is, and you're always coming that big. I think really the very good say that coming really I think was a lot of learning and really how to move the talk and right work on answering.
Thank you so much. Yesterday, there was a question from the floor, including the physical sense. It could have been missed out. There was specific to wash accounts, and there was a question on any linkage. As we need to track over the investments here and there, is it possible also to identify, establish if there were any linkage? There was so much money, there was so much funds that were invested. And were they all used, both utilized as expected, or there was some leakage? If not, is it possible that this can be considered moving forward, maybe under 3 or 4 Thank you.
Just clarity, is this the linkages or linkage? Linkage like filtrage. Filtrage.
No, leakage. No.
Are there linkages as in money lost?
Yes.
Or linkages as lost? Money.
Yeah.
Please check the charts. Please check the chart for the online people, their reflections.
Thank you. So I think what we was also noticed that they, as well, it was the wash accounts and speaking of leakages and leakages, I was thinking a linkage with cost of an activity kind of assessment would be very good for this kind of wash accounts. I heard that the ministry at some point when they were coming up with the cost of an activity report, like what is the cost of us not implementing in regards to what I think the two need to be linked up and give us that industry what accounts they are about being
Anything online friends? The other person, the reflection about yesterday. Yeah, I'm not happened to you, but just areas that stood out for me is the fact that there are a lot of efforts to monitor climate resilience wash, as well as wash system strengthening, and a lot of work going on, and that's very much appreciation of WHO and UNICEF in that direction, and of course the call for any technical support from colleagues within and also outside to see that that goes on well, and we hope doesn't take us longer than 3 years as it was for us, but hopefully more will happen. So the other thing that probably I needed more information is about to HMIS 0917 and quarterly reporting report for entities that is now having a component of healthcare waste management I can be guided there better. I wanted just a confirmation how far this information is trickling through the biostatisticians. Because usually when we ask the biostatisticians, right, some of this information, the issue that these reports are coming through, but we're happy to see that this is being reported at the global level. Yet sometimes we have challenges also having this information come through at the district level. So the issue here is this tool really being used down, and the biostatisticians in position provide us this information. Or this was a one-off kind of assessment and not something that is routine. I wanted just a confirmation.
To respond to them. Yeah, a question about how information trickles down to biostatisticians, a question about the cost of inaction regarding the health and wash accounts, leakage. The question of leakages, you know, from the invested funds, I think the rest are mostly impressions. And for me, I think the most outstanding thing yesterday was it is possible to actually align, given the experience of Ministry of Health that was shared by Mr. Kayanja, it is possible. And since one of the key objectives of this workshop is to move towards alignment, I think we already have some places to learn from. For me, I think that was a very, very good experience to share. The possibilities are there. How do we make them happen? That's something that we should be thinking about as we move towards the end of this workshop. But there's more learning to do about other monitoring frameworks. And then at the end of the day, we shall have the whole array of the frameworks. Then we'll see how we can find alignment in that broad spectrum of frameworks available for us. So now we go into GLAAS. GLAAS is GLAAS. GLAAS. L-A-A-S. So we're going into GLAAS.
And I like what you said yesterday. Is it fun?
Today it's happening.
And I hope that after our presentation with Ivan, it will be, yeah, over. Yeah, before we start, Ivan, I think that probably everybody knows Ivan, who just arrived. He was called yesterday, and maybe you can present yourself first. But before we start, well, Ivan is coming. How many people, who has heard about the GLAAS? Who knows about GLAAS? I am not talking about the drinking. Who knows about GLAAS?
What extent?
Nobody?
What extent?
Ah, okay, to what extent? True. There are two. I was going to talk about the second question. The first one is, who knows about GLAAS in general? Who participated in the GLAAS data collection exercise in the 21-22 cycle? So the first one is, who knows about GLAAS? Oh, there's a lot of hands. Okay, that's good. That's good news. Now, who participated in the data collection, participating in the process, not necessarily yourself, but your institution? Who was involved? One? That's all? Two? Yeah, of course. The Minister of Water. Of course. Minister of Water. Ministry of Health. Yes, you were involved. That's all? Uh-oh. Uh-oh, we have. Okay, maybe some people changed and, there is someone new in water aid, he was not in the previous cycle, maybe. So that's a major challenge for Ivan, who is the focal point. So if you don't hear about the next cycle, please contact Ivan and say, well, we want to be part of it. Now, Ivan, I give you the floor to present yourself, and we're going to present together the PowerPoint presentation. I didn't present myself. I did.
Good morning, Teresa. Most apologies, I was supposed to be here since Tuesday, but well, I'm here now. Ivan Visa is my name, and it's being presented there. And the wash accounts and I'm not old enough.
You are. You are
You don't hear, okay, so,
Okay.
They're also online and.
yeah, people.
We also can't hear. Okay, let me start again. Ivan Visa is my name, and I'm the GLAAS and wash accounts focal point officer. I was supposed to be here yesterday, mainly for the wash accounts presentation and given more insight, but maybe in the discussions later on, we could substantiate some clarifications which need to be made if they weren't clearly done yesterday. But for GLAAS, as you're going to hear from the presentation we're going to make, it usually happens every after 2 years. So the last one we had was 2022.
Yeah.
And if you see some of the results and they're not familiar with the up-to-date, kindly keep it in mind that these are 2022 results as of then. It is not by choice that we have it every after 2 years. That is how it is structured, as Didier is going to give us more insight on that. And once again, I'm glad to be here, and I look forward to sharing more with you as far as GLAAS and wash accounts is concerned. Thank you.
Thank you, Ivan. So, I'm going to present, can you go to the first slide, please? Thank you. So, and since there were some people who didn't raise their hands, we need to go back to what is GLAAS. So GLAAS is the UN Water Global Analysis and Assessment of Sanitation and Drinking Water. We also cover hygiene, climate change, resilience. We cover other areas. And as Ivan was saying, usually it's a report it's a global report that is carried out by UN Water. It's WHO is leading, but I will explain about the changes. The second point here is that this report this year is going to be implemented by WHO in collaboration, strong collaboration, coordination with UNICEF. It's a little bit like the JMP, which is a WHO and UNICEF program. It's going to be the same this year. We have worked a lot with UNICEF in previous years. We're giving every 2 years, an average of every 2 years, a global update on wash systems, including policy framework, institutional arrangements, monitoring systems, regulation, human resources, and finance. And as I was saying, there is more and more questions coming up with on climate change resilience. Try to see if it's possible. Okay, as you know, the monitoring of SDG 6, SDG 6 gives global indicators and targets, and UN Water coordinates the monitoring of the different targets. Rick presented that the first day, but just to remember that GLAAS is in charge particularly at target
I'm sorry, I've lost the sound.
doing that, but then at the end, we feel we look at the differences in strength for the different. Finally, we analyze and highlight data. Some countries, in reports, we use country highlights, and everything is available on the as data portal. Very important. Very strong collaboration. And this could be with WASMO, the African water sector monitoring and reporting system. I think that in each country, ANCA has focal points. I don't think it's you, you're not the focal point. So, very important.
The work on GLAAS with what's being done with Antel.
For instance, one big important thing is to
And I was talking about watch accounts yesterday. Watch accounts is allowing a lot countries to report to Antel about the water expenditures, especially to look at the board commitment.
I'm not hearing anything.
WHO and UNICEF are core partners in supporting government in provide and prepare reports in the country highlights. Everything will be available and it is available for the last report on the GLAAS data pool. I will give you the link later. Very important also, GLAAS is responsible to report on SDG monitoring of 6A and 6B. The GLAAS is also leading on the water account using the tracking methodology. What I said yesterday is that when we ask in the GLAAS process, if countries are saying that there is not enough funding in the sector, everybody, pretty much we said 75% of countries say there is not enough funding in the sector. But when we ask about how much is missing, what is the gap, very few countries can give data on this. Very important in all this process, we have very strong collaborations with different actors. It's like our city. Water aid, water for people is yes. NBTF, the World Bank, UNICEF, AMCAL. So it is very important that we work together to provide a status, a situation every 2 years on the water sector, looking at bottleneck areas that we have in the sector. Nice. So why should you all participate in this process? Well, first, it provides a useful situation analysis of the water system. Or the SSIP, for example. It helps decision makers to define priorities and devise plans. It goes back to what you said. When you have the data, what do we do with it? It's the decision makers who have to have the information available to make decisions, appropriate decisions based on data, based on facts. It contributes to the SDG monitoring and regional monitoring initiatives. Countries have reported that the GLAAS process and data collected through GLAAS have contributed to improve sector coordination because people are needing to answer the GLAAS questionnaire. It helped in some countries to develop policies and plans and strategies. I mentioned yesterday in the water counts process, it helped in Nigeria, for example, to prepare the roadmap for improved sanitation and watering strategy. It gives a stronger national monitoring and review systems because we're going to see what the gaps are, what are the difficulties we're facing, and it's an advocacy process, a tool for funding financing. I mentioned yesterday, Mali, when they saw that how much the gap was in the funding for their national plan, the minister said, I'm going to bring this to the Ministry of Finance and increase the funding. Finally, it's an international and regional reporting. So it's not only for the country, but it's also to report at regional level and global level. So this is really an opportunity for you to be starting the advocacy at country level, but also to provide information at regional and global level to compare with other countries. Here is the link for the GLAAS. This is the link for the country highlights. The very big advantage of that is going to be just a few pages to give you what is the situation in country for the last report. So as Ivan was saying earlier, the report is coming out every 2 years. So what's available there is from the last report from the 21-22 cycle. And I'm going to pass on the floor to Ivan, who is going to give us a few information about that.
Thank you. So these are some of the key findings from the last cycle, the final report. This is as far back as 2022. So we categorize in these different areas: policy and plans, targets and progress, standards, coordination and monitoring, and financial resources. We try to look at strengths and weaknesses. From the findings, we believe our state plans approved and fully implemented for water sanitation. In terms of the C, the sector, strategic sector investment plan. But what came out clearly is that much as the C looks at wash, water sanitation and hygiene, hosting hygiene implementation activities is not so easy. The gurus here can attest to this, and maybe we can find, because hygiene activities are more behavioral in nature. So when we are looking at the strategic investment plan, it may not come out clearly on how hygiene is. Much as sanitation is easier because it is hardware in a way, but hygiene is still a challenge. And probably that's where we can improve some. The targets are clearly defined in the strategic investment plan. But now the challenge is the progress towards achieving those targets. As you know, the constraints, one of them is the resources. So the targets are set and they are clearly developed, but in terms of how we are working towards achieving them, it is still a challenge. And then for the standards, it was clear the standards are there. Maybe the challenge is how often they can be reviewed, because some of these acts are as far back as 15 years ago. The question is, are they still applicable to the current day and day situation? But at least one thing to note, we are not moving blindly. We have a guiding legal document which gives us our mandate and what we're doing. Then the coordination was also really high up there. We need to have in a gap in here, because we have the program working reviews, program performance working reviews, where we believe all stakeholders in WASH come together. Initially, it used to be sector, but as we move direct from sector to the program approach, we still want to manage the program approach, and the reports are clearly indicated that there's some coordination going on. At least we have a platform
where we always come together on a routine basis annually and discuss issues with WASH. When it comes to financial resources, some of these are not easy to track. I'll give you an example. We have some of the fund which is being routed through IFMS, but it is not as clear as GOU fund to track some of these. And what comes out clearly also is the off budget. So we still have a challenge here, and we believe we need to have a better conversation with Ministry of Finance on how best we can track WASH financials at that level, mainly from the off budgets, because we have the on budget clearly trackable, but off budget, and we realize there's a lot of funding coming to WASH through the off budget channel. Then, of course, we're in the second cycle of WASH accounts using the drop-in methodology. But the results are not there yet, but from what we are seeing already, the disparity between water and sanitation and hygiene is still very clear. But this we shall talk to more when the results actually after we really published it, the findings. Yes. So the GLAAS process, probably this is where we need to know what has been going on so far. We started introducing GLAAS, and this is one of the platforms we're using to introduce a GLAAS to the different stakeholders. Then the government decides to participate. From the GLAAS conditions and modalities, government has to honor up. This year, we are partaking in the GLAAS process, and we are going to be preparing a GLAAS report in the Ugandan perspective. Then, of course, we go into pre-data collection. This is where we map out the respective stakeholders. But maybe at pre-data collection, I need to point out that every specific year, GLAAS comes out with some specific areas where they believe we need to have a uniform global trend of comparison to see how Uganda is faring against the others. Case in point here, in the last cycle, there was a category that came in to give a scenario how Uganda copes with the COVID crisis and what were the effects in the WASH sector based on the COVID. So this was one area which was critical. And as VD has highlighted, in this year's cycle, you're going to find that climate resilience and climate change effects is one other area which is going to be critical for us to focus on and see in the WASH sector in Uganda, what are we, how are we being affected by these climate changes, and probably what are our. Then we also, now here we go into the data collection. This is where we have the conversation with the different stakeholders in WASH, who are quite known. But key to note here is that the local governments are one of the most critical stakeholders here. Not to say that they're the only ones, because we need data from all the other stakeholders, the NGOs, the donors, government as the institution, and then we have to collect all the data. But I must say, GLAAS in a way, because they intend for us to paint a picture which is comparable at the global stage. There are limitations on where we have to go and what data we have to collect. So that at the end of the day, the data we're putting in there can be on a global stage compared with the others, how we are faring. So the template is clear on what we need and where we need to go. Much as a country, we may want to reflect some areas. If the template is limited, we may not really put that across in this particular presentation of GLAAS. Then the fifth stage is validation and submission. So at validation stage, after we collected all the information, we share with the stakeholders and they validate that what we have is actually a true representation of the current situation in the country. And then, so at submission, that's when we submit to the GLAAS secretariat as a country. Submit the GLAAS secretariat, and when the GLAAS secretariat receives our data, again, they also go and analyze what we've submitted. So there is a GLAAS report, an overall GLAAS report which is presented. Now, the overall GLAAS report may not specifically give the detailed data we've sent in, but it will give highlights of Uganda, where they feel these are the highlights that came out clearly in different areas to be presented to all the would-be stakeholders that benefit from the GLAAS report. And then lastly, the GLAAS report is published and available mostly on the website for anyone to. So it goes back to the other link which DK has highlighted. So when you go there, you will find the eventual findings from our submission from the last cycle. Next. So this one is mainly giving a detail of what I've been talking through about the whole different stages. I think we can skip it and go to the next. Keep going. That look at the data collection. Maybe you can look at data collection and have more. So here we're saying the national focal point for these responses from the various stakeholders. So the ministry takes lead through the focal point officer, and then data collection and data conversation is done in different ways. Probably we have meetings, discussions. In some cases, we can have questionnaires, we can have templates which we design and get feedback from the respective stakeholders in this case. So, but this is where the gist of the work is, the data collection, so that we can populate that survey template which is available. Probably go next. Yeah, so you can see come introduce the data and signs of the results before submission, the stakeholders involved in completing GLAAS. So this is where we're going to maybe come back to most of you. Basically, what happens here is we go to maybe USNet and we're pointing to different NGOs for data. So at this stage, you come back to us and say, from your previous reports and your understanding, is this representation what exactly is happening? And maybe from the water officers we've gone to for the pilot districts, is this a true representation of what's happening at local government level? So this is the class, this is the point where we do that validation. Okay, we'll continue. So we submit, but the timelines are set for this year. As you can see, by 15th October, we're supposed to have made our submission. So we had to design the roadmap, but at least we need to work within that time. Our lines are drawn and we should be done by the time. The others I did also how we submit. And then maybe you could go to the data management. So this is the true reflection of how the data is managed. What we've been explaining mostly is from April to October. That is where most of our input as a country is. Then after October through December, that's when the Secretariat is now working with our information. And they're trying to make sense of what we presented. And the report is supposed to come out at Sunday after December. Next. So this is just a reminder that we need to have a GLAAS focal point in place. And one thing that is critical here is that we need to have the country world localization office. Because as DK has highlighted earlier, GLAAS is mainly facilitated by WHO, and in this case, we're going to be partnering with UNICEF. So everything we're doing as a country, we should have the country offices in the loop and we should be moving together. The other is just the options which have come in. Earlier on, we've been doing it in a particular survey and submitting, but this time around, there's an online option. So we'll have to decide as a country whether we prefer the online option or we stick to the other work. But this is something that we agree with when we start the process. Okay, it's reaching out to Horatio and himself, and the deadline is still highlighted there again. Okay. Thank you. Just before bring the micro back to the boss. This is very important. You have an opportunity to participate in this process. And we count on you to contact Ivan to really make sure that we have all the data, all your views on the situation, on the GLAAS, on the situation to prepare the GLAAS. Thank you.
Thank you very much. I believe there are many questions, especially questions on the framework, specification, on affairs, definition of indicators, methodology. Those are grades in this course. They want to speak about things from that perspective. So you can be sure that few of us will be asking this question. Like, the last year. The grants of one goal, how do we do it in looking at PSO, the PhDs, for others, all of this align our day-to-day work, service delivery, and how does it turn into what our service for the engineering?
Thank you very much, Lydia. I think she was great. Good morning, everyone. With the JMP and GLAAS team and the reports over the years, but also during these last 2 days. And I realized that these are good reports that we read on as a country. Purposes of life beyond our players that are not within us here, but they are critical role, for example, for allocation of resources to the sector. But we are not able, we have not been able to use these reports for that purpose. And I think we need to, as government, as ministries, to really pick out the lead and run with it. To use this on a global scene in relation to the performance in other countries, so that we don't remain the ones lagging behind. Relatively, I know one of the things that stops us living conflict, that is because better. That's actually where Uganda is supposed to be having something. There is no report. So I'm not talking about what this one. The JMP team or the GLAAS team go to an extent to make sure that the data that is available, it's not just the what's the result of data? It's not good for us when they say it's not because then we want to use the reports and they have a data report. So it puts us and of course, I want us to link to the table. We attach data management and you know for that. Data and management stakeholders that planning. And so we must facilitate it that the report is help us
and achieve our objectives. And in fact, I would like to appeal to you. And I'm looking at Stephen and Dr. But I think we have our inefficiencies and struggles. But we want to learn from you to sympathize with the speaker, to make sure that we are like aspect for the national processes, but also global report. I was thinking that in the process of the GLAAS and the JMP, which are prominently the country offices, the steps. So we want to see that a little more. And lastly, I'll ask myself when the JMP and the GLAAS report out. And this goes to the GLAAS team and the JMP. What is that? So what? What is the next step after you compare that with the objectives to us? What do you do beyond that? What do you use that data for other than understanding the global situation? We want to believe that you're in a better position. Because you play a global level, traveling, still makers of the global. All that. Are you able to position and say, because this part of the world has been reporting badly or has been showing a bad picture, are you able to position and attract surveys with sources from those local donors or whatever, so that we see additional values to the reporting? I think it's needed. It's tremendous. Thank you very much. I'm not also the feedback. Okay.
It's too low.
So, yes, thank you very much. And today we have so one, when you need to do something, you know, it sounds very exciting. So today, we have to know, as much as I'm a board member of the government, I am not. It sounds not to me. So this means we fall so short when it comes to organization of the key document that is for anti-piracy beyond Uganda. And when this happens, therefore, then the questions that have been coming up when it comes to everything to come up. Because I've been at very many for a lot of people, those things I'm saying, I feel like exercise everyone that is not perfect. But then now we're here, it's just us, but reached out. How can we be deliberate in popularizing the processes so that everyone accepts the data that comes out there? Otherwise, then it brings the question, the moment we know where it's coming from our country, then we get into the situation of saying, maybe it's not so bad. Like when someone says, is it really true that over 20% of the data is still practicing open education? So we need room to eradicate the doubt so that we can build this things and also right now, there is a new person on the edge lab, right? There's this Bible. Now everyone is trying to work in when it is presented, they don't want to have. If we are accepted that one. then to what extent do we leave data collection to voluntarism? We are not of having data being collected by VHT, but to what extent that voluntary quality. Data and local building collection, even though the underlying causes of why some regions are the way they are. So how do you then support us to advocate for some of the forgotten cousins, like the hygiene cousins? In WASH, hygiene seems to be the forgotten cousin. But then how do we make sure that these are the big boys that drive hygiene, water and sanitation, facilitate hygiene? What can we change? Can we say that a latrine is not a latrine without a hand washing facility? Can we say that a household is not ideal until it has a latrine facility? What can we do to make things better? I think something.
Thank you for the presentation. My name is Augusto here, from Ministry of Health. I'm glad to be involved in this presentation or understanding this presentation for the first time. I've just been hearing about GLAAS, not really getting the details. So I'm happy that today I'm getting the details. And just a quick one. Does GLAAS help us to monitor SDGs? Yeah, that is one simple question. Then the next one is, now that we have, how is GLAAS India listed? How is it conducted usually? Because in Uganda, for example, we have a system that we use for picking our WASH data from the households and displaying it to the national system. So is GLAAS parallel from that? Shall we use the same system as how we are coming up with a WASH management information system as Minister of Health? So how will this be integrated to GLAAS? Those are the two questions I have. Thank you.
I was excited to see one of our members, the local side, I was presenting, but I think I would have been more excited to see what was the report, the previous report talking about Uganda. What is the situation? Because we are looking at localizing, and how does this report help us to speak to the political arm of the government? Because if we continue leaving it as is, and with all due respect to the people of a different color in this room, our political leadership tends to think that this information that comes from up there is tainted to the wrong direction. So how do we ensure that this information is actually localized? But also the other question that I'll ask us, and I think someone acknowledged that the tools are becoming too many. We do not have one that we are holding on to, and it is running from start to end. It is always this tool, then before we are knowing there's another tool, there's another tool. So I don't know, the bus is going too fast. Someone enters, then it leaves and leaves 20 behind, then another one comes, then we go. But is there a way that we are tracking that from this tool we have improved to here? You know, because when Ivan was presenting, he said, unfortunately, these tools are not able to take in what we want to see as a country. So are we actually having our hands on the ground? Are we moving fast to go to the international level before we settle our national, our national needs? But also, how do we influence this tool to cover what we have as a problem? How do we get this sanitation or hygiene issue onto there? can there be an agenda to make sure that hygiene for the next cycle comes in? Can we see someone maybe funding or coming up and say, okay, hygiene can be monitored like this or can be adopted like this, let us adopt it. Because if we do not be that deliberate, these things continue to bring us into these meetings, but don't bring the tangible effect that we want to see for the nation moving forward. I was excited yesterday when I was speaking to the director, IRC, and she said with these tools, was it Malawi, I think, Malawi or something, was able to get a ministry. Ghana was able to get a ministry. Now for us as government, Ministry of Health, Ministry of Water, what are we getting out of this? What do we benefit? How does it speak to our political sphere? You know, how does it speak to all the political sphere? Because believe me or not, if we cannot speak to the political leaders in parliament, there's a bit of a waste of time having this, you know, so it's something that needs to scratch our minds. It might not be exactly for the point alone, but for all of us. How do we get news out there that is critical and the right news using these tools, using his report? I'll beg to submit.
Thank you.
Thank you very much, Paul Sanya Jackson, Minister of Education and Sports. I kindly just need to raise one question, since people have raised very many. I thank the presenter on GLAAS when they asked the question, who has participated in the class and kept quiet, because my colleague Musa attended Biruji Musa. So personally, I did not attend, therefore I couldn't say I was one. Now, the question I'm raising is, I did not see the issues of inclusivity. And the inclusivity issue where the GLAAS is prioritizing the people with disability and the learners' disabilities in line with WASH or WASH in school. So it is targeting other groups, leaving another component of people who really need service of GLAAS. So kindly can see how best we can integrate with the persons with disabilities or those dealing with requirements so that we can have inclusivity in it. Thank you.
Thank you.
Well, I said next to Ivan, so he seems to do something directed them to him. But I think the conversations we are now having, we seem to be zooming into how to strengthen, which is great. I think that was the issue that tomorrow, let me draw close that has become we can actually draw to real tangible takeaway to help bridge that gap in the country. We appreciate the different databases, the different systems. We seem to be having most of everything, most of the things, apart from a few that I think if we came up with a roadmap, one, to bridge the gap of what we don't have, make it critical, but also improve what we already have.
Can you still keep the mic for the online participants and they hear half of it?
Okay. So, and again, we appreciate the different mechanisms.
The mic.
I think we are at a good point to actually build up the grand scheme of things as a country. I was asking Ivan and I said, you know, if GLAAS gives a summary of a situation analysis, going to just pick it up from JMP? If JMP populated, then to what we wanted to have. And just pick that up from there, or do a little bit of maybe validation so that we don't have so many systems, so many tools going around, and yet we're almost speaking about the wash situation will happen. So that maybe can go to the global team. These systems and tools should be able to speak to themselves, maybe not to 100%, but if it gives you about 70%, then build up something to the 30% without so much effort. Otherwise, with the discussion of setting us into in-country strengthening, I'm happy. And I think by then tomorrow we'll be good to go with the draft. Thank you.
As we speak, we shall request to be a bit louder as we get the batteries.
Thank you very much. I think I was wondering where until today's presentation. When you look at the JMP, it is joint monitoring program for water supply, sanitation and hygiene. And it removes country regional global estimates of progress on drinking water, sanitation and hygiene. You go to GLAAS, it is sanitation and drinking water. So what is the difference? Is this another scenario in Uganda where you're creating IGT, Auditor General, and art corruption, protection, and then the problem we seem to be fighting does not end. Because now, I don't think people have fully appreciated JMP. It is coming every 2 years. You're bringing in GLAAS every 2 years. So is this some technical, someone who's not comfortable with the name JMP, and then they try to come up with GLAAS? Because what are we trying to achieve? Thank you.
Thank you.
The microphones are down.
As we are getting.
Very much. I think my colleague from Living Water has raised the first point I wanted to raise. IRC is part of all this, and sometimes I'm not too sure where. And what is happening, but as a support institution. But looking at it from the other side, I am assuming, my guess is, we are participating because we are members of the UN. That's the first thing, unless there's another reason. And if that's the case, DD and GLAAS, are there countries that do not participate? Are there countries that do not participate in either GLAAS or JMP, but they are members of the UN?
Yeah, you're right.
Yeah.
Oh, if that then is the case, then at the country level, we have the focal person, but government is responsible as a member of the United Nations to drive this. But yesterday I had misgivings on, we didn't know this was there. Oh, you mean it's also in the Ministry of Water and Environment? We didn't know. So if my government does not know, then what am I supposed to do? Two, if my government does not know, how do I work and help my government to know so that I can know? Because at the end of the day, it targets government, and that's why they go to UBOS first. Then they will go down to the sector performance report later. So we need to do something in our house first. how do we ensure that government knows? If I ask in this room, even those that are involved in sanitation and hygiene, how many of us in this room know the goal commitments? Because what are the nearest to us? They are in Africa. From AMCAO, we are members of AMCAO. But every time the song is the goal commitments, we are monitoring goal commitments. Who is monitoring goal commitments? Do we even know goal commitments? So we need to go back and revisit a number of things in terms of procedure. We are not helped by the politicians who go to these conferences, they sign up treaties, they sign up conventions, they sign up stuff. Then they come back and say, we signed. What did you sign? And how do we pick it up? Because they signed. I was a witness to the signing of the commitments. And I know the minister who signed. She is no longer a minister. We don't know how much she left behind for others to pick up. And then we get harassed by AMCAO. You're not monitoring goal commitments. Where are they? Who is the custodian? Who is following up? And how do we hold those ones accountable? And before they even sign, how do we make sure that we know exactly what they are going to do? So I think it's going back to our own procedures and not getting forced into things that probably we don't know. And if it is done by our politicians, how do we combat that? How do we get into that? When we were preparing for the UN Water Conference, we were all running up and down like headless chicken, looking for stuff, looking for this. Do you have this? Where is the data for this? And then, hey, thank God I'm not going. Because people were so busy. Then we came back, we signed up some recommendations. We don't even know where they are. You know, that habit, it's there, but how do we then help our governments? I felt so bad at reader yesterday when you were asking me, where you mean it is in the ministry? And reader is the senior person in the ministry. But she wasn't even aware. Wash account, JMP, GLAAS, how many others reader that you don't know? There are many. There are very many. So how do we combat that? How do we address that? And some of us who go for this conference, you get really embarrassed when your government person, especially a political person, stands there and doesn't even know what exactly he or she is saying, has no idea. So you say, why did they leave the technical person who came with this person to speak? Because at their level they can say, oh, Martha, you can please make a contribution. But they go on and on and on and praising everybody around, but not even saying anything tangible. So let's see how to go back to that. How do we fish out what we don't know? Thank you. Yeah, I will not submit, I'm not a government person.
Yeah, thank you so much. I think I joined the rest, the members who never heard about GLAAS. It's also my first time. But when I look at the whole thing, I was wondering if there were gaps in JMP that GLAAS is coming to address. Why not integrate the two? For example, if GLAAS is focused on policies, standards, can GLAAS be used to improve JMP so that we have one system? Maybe change the name slightly,
Other than having two separate systems, that's my observation. Thank you.
Yeah, maybe I also have a question. Can a country choose to maybe submit to one? Or it's a must to submit to both GLAAS and JMP?
I can say specifically to you because I know you're involved in preparation of the water and environment sector performance report. What you get from this class, how does it fit into the sector performance report? Because that is the document that speaks to the government and to the sector and to the program. What initiatives are you putting in place to make sure that as you are at the focal point, this is not disappearing on your desk? Because you can hear the volume in the room. It says not known, unknown, not sure. So as the focal point person, you have a role to play to amplify this voice and get it captured, even though however bad the news is, spread the news. You know, so that it catches the eye of those who actually require this information. And I think you are in a good place. As the liaison department, you are in a better place. So maybe the GLAAS office could facilitate the focal points to amplify the voice. Thank you.
Okay, let me just give a background. I think because of fear of the declining cognitive capacities, so I try as much as possible to take keen interest and I follow. So I followed properly the purpose, why we are participating, and also when we looked at the slide of key findings, I wish we could go there. To me, this was the central or the gist of the matter, key findings in the first cycle of GLAAS. But when that one was presented by one of us, Ivan, but it was just highlighted policy, target progress, standards, coordination. What we have, to me, I didn't see any finding apart from what we have. You can go there?
Yeah, can you go back to the key things, the table with? This one, yeah, thanks.
Okay.
Okay, there are a lot more, but
that's a very good slide to lead us into the responses. Just reminded me of one of these big events that we went to with a certain minister, and we had taken the trouble to prepare for him a PowerPoint presentation, and it was so nicely done. And then when he reached that among other ministers, when he lost his PowerPoint, I don't know, he started commenting about the ministers. Oh, the minister from South Africa is very beautiful. The minister from Zimbabwe is looking very sharp. I am sitting between very beautiful ladies. And you know how the technical people had taken the trouble to make sure he has the most impressive presentation to make. And we were all embarrassed. We wanted to hide under the tables, but you know those conference rooms don't even have tables. So these things are real.
thank you. I'm really glad that you're bringing all these questions and comments, and really it's very good. And I will try to answer some. A lot will be answered by Ivan.
Mindful that and our team read back in the
Yeah. No, just before going to Ivan, I would like to clarify a few things. Something that is very important, and there were some very excellent questions. need to clarify the difference between the JMP and GLAAS. That's very important. JMP is monitoring, and I have to say, for both JMP and GLAAS, the data is coming from you all. I mean, not all, because some of you didn't participate in the process, but it's coming from national data. That's very important to mention. For the JMP, the data is coming from UBOS. I saw the lady. Oh, sorry, you changed it. So the data is coming from UBOS for the JMP. JMP is monitoring the use of different levels of water, sanitation, and hygiene services with households and with schools, with schools and healthcare facilities. That's what they're doing. The JMP, the GLAAS is looking at inputs. So we're going to look at policies. The JMP is not looking at policies at all. So we're looking at the environment that will be very important to improve the wash sector. What has an influence? The idea of bringing the two together, we had a lot of discussions at high level, political level, saying, well, we should merge the two. Have you seen the GLAAS reports? It's huge. The JMP report is huge. We report on so many countries. You can imagine how big a combined report could be. The very important is that we provide the result, the situation for all countries that participate. And it's important to present that and to present the key elements globally, not only country by country, but also globally. What are the lessons learned for the sector in the world? So it would be difficult, but we are still discussing about this possibility. One thing that was mentioned by everybody, I think everybody agrees that there are so many tools. And we all come to you, say, can you fill it up? And it's a lot of work. And this is why we're looking at this process for wash system strengthening, because we all come to you with questions. We are not harmonized. We ask probably 3-4 times almost the same question, but with a different angle, because we think that the different areas are very important. And the discussion started between, it's IRC who started it, on the wash system strengthening. They started a process 2 years ago with the Ghana workshop. And really, the idea is, let's get together between all systems to see if we can agree on the key indicators, so we don't ask 4 or 5 times the same thing to the countries. For you, it's a lot of work. It represents a lot of work. So this is the idea. It's going to be probably, Marina yesterday said that it's going to take probably 2 years to arrive to something, and this is, I think that if we can do it in 2 years, it would be really good. It's taking time because we need to look at what the partners would like to develop, but we need to make sure that it responds to the national needs. And that's very, very important. Everybody said, okay, we have all of this, what do we do with it? Well, it's a good question, and I'll return that to Ivan. What's very important is that the data that is available, it's available to you. What we are doing with those tools is to give us a situation to help you define, present the situation in the country. Our role is really to help you to collect the data in a certain manner. Now, we need to discuss between the different systems, but yes, we present a situation that comes from you. And then what? It's a decision. Then you were saying, well, what are we going to do for the next step? What can we help you do? The first thing is to bring this to the decision makers. Now, are they going to take it forward? It will depend very much on people, not on the strategy, but it's going to be very much on people. What is important, and I invite you all, can you go back to the website that I gave you? You have on the GLAAS website, you have all the data available. So in a way, all the data, all the questionnaires that were presented or that were sent to each country, all the results are available there. Now, because it's so much, we're trying to do country highlights, and this is one, or this is one policy. It looks like hygiene is not there. You will see in other categories, it is there. But can you scroll down? You were saying that I could, but that it's just, we're not going to go back to the questionnaire, which is very long, and the new one is going to be very long. But what is important is that the data is there. Now, there is it is the role of the country to say, this is our situation, we're missing this and this and that. What are we going to do? Maybe it's not a priority. If it's missing compared to other countries, that's okay. It is very strategic and political at your level to say, should we do something about it or not? And there are some things, okay, this is about external support. Looks good. You have a lot of green on this. You have defined procedures and laws in policy for participation. This is for 6B especially. You have things that are very good. Can you go down? Let's go see if there are some areas where there is some red. No, it's not on this page. Oh, there is something here. We talked about resources, human resources. We're saying that, well, looking at that graph, it's about 50% of what human resources should be working in the sector. Do you consider it as a priority? Should you work with the decision makers to increase the number of people working in the sector? It's your decision. Can you go back to another level? Okay, that's a very big one. Reported wash expenditures by subsectors. This, wow, it's pretty good, but when you look at the difference between sanitation, drinking water, and hygiene, and sorry, just to mention, sir. Sorry, you were asking about hygiene. It's right there. Oh, or it's not there, actually. Yeah, but that's reporting from the country. No. So JMP is about access, the use of hygiene, hand washing. So this is one thing. This is looking at the reported wash expenditure for hygiene. We didn't have any data. What's missing is the data available for expenditures in hand washing. Do we have the data? Yes, there is some data with UBOS on household expenditures for soap. There are some information there, but how much support is going to hygiene? This is something, it's a situation, that's what came out in the last report, that's what Ivan was able to collect from the different actors. Maybe the data is missing. It is possible. It's not that there is no funding going into hygiene, but the data was not available. Okay, now, when you see that there is no data available, what do you do? Is it a problem of reporting? Is it a problem of data collection? This is something that needs to be looked at, and you need to decide. It's not us. This report is not for, it is for the GLAAS team to report at international level, but it is mainly the first thing is that the data is for you. It comes from you, and you should decide what to do with it. I was mentioning in Nigeria, they use the data from GLAAS and wash accounts to prepare a strategy on hand washing. They use the data to say, we need to develop a strategy on hand washing. It is not us who told them to do that. It is the government of Nigeria who decided we need to do that. So it's really, the idea of this process is really to look at the situation. You look at the situation, you try to respond to some questions, key questions that seem to be important, and then you decide what you do based on the situation that you find. Now, you were mentioning, okay, we have a set of questions, and we're going to be, all countries will follow the same set of questions. But at the end of the day, at the end of the exercise, you can come back and say, okay, here are our results, but we think that there are some areas that are missing. Please share that with the focal point. So the focal point, and politically, it could come directly through ministry, country office, HQ, regional office, and HQ. It can come to us, and we can see for the next report what we can do. This is very important. It is, in a way, it is, we can see it as our tool, WHO, UNICEF tool, but it is first your tool. Please use it and try to make decisions from it. Now, I think I better leave the floor to Ivan, who is the person to contact whenever you have a question or want to make sure that you're involved.
Thank you, colleagues, for those nice insights or questions. I want to finish first of the question because some of them are the same and some of them. But let me start with some which are exact. There was one where I think it was one of the last ones. As a country, do we choose to participate in this or not? I'll tell you for a fact, GLAAS, every country doesn't participate in GLAAS. There's a specific number of countries every given cycle. So in one of the processes, I don't know where we highlighted that the country confirms participation. The reasons for that are clear because the country wants to get on that platform and you really can benefit from that platform. So it is a country choice, it is not a must. And over the years, Uganda has always opted to participate in this. A related one, the information we have in GLAAS, where do we get it from and is it different from? I'll tell you that in the wash sector, to be specific, we have quite a number of monitoring platforms, monitoring frameworks. We have data provided on a quarterly basis, and in some cases even a monthly basis. Now, in GLAAS, we try as much as possible to speak the same language. You will not find information in GLAAS differently talking to what is in the annual program performance review report. So this takes me back to what Doreen was asking. What fits into what, or what should fit into the other? Actually, it is the performance report information that we align and should be reflected in what GLAAS is saying. But the difference is this. In GLAAS, you're not going to find me talking about access or the capacity of water stored and something like that to manage capacity. No. Like Lydia was saying, GLAAS majorly looks at policy-related issues. So at this point, this is where I wanted to make a picture. When you look at these three different tools, GLAAS will come in looking at how policy can be influenced in the wash sector based on the results. JMP is going into the processes mainly. If we are moving ODF from here to there, what has been done, where is the gap that we need to do? Then wash accounts is specifically talking the language of how are finances in wash allocated, how are they got, how are they spent, what is the involvement of everyone in allocating these wash finances at all. That is the specific focus of wash accounts and using the topic. So if you look at it in that picture, they could differ in a way, but at the end of the day, we are talking about the same specific that. The best example has always been when we had the sanitation coverage, I think. And for the sanitation people, they know very well, there are some sanitation facilities which JMP exoneration doesn't take them into account and only looks at a facility which has ABCD. But then when we come to our report, we are saying if this is a safe facility to us, we can take it into account. But then the question is, does it meet the other standards? And now I was having a discussion with Bella there. We are saying now there is also the SDG monitoring framework, which is global at a certain stage as well. And funny enough, I am also the focal point for SDG 6. So it is a very interesting conversation. But I wish to look at it in the way Jen brought it out. We have these different platforms giving us a direction. How are we turning it around to benefit mainly the target group, like in this case, the political people? If you have a GLAAS presentation showing that probably Uganda was doing well as far as the legal, the policies and all are worked out, but in comparison to some other well-being countries, where do we want to be? How can we improve that position? For information, we've been doing so badly with our political people, but lately, as a ministry, we have started improving. I'll give you instances where we've managed to arrange a conversation with the Natural Resources Parliament Committee. Now we're looking at these guys as our entry point into the political stage. So we have a conversation with them alone. And at some points, we even take them to the field. So that when you talk about ODF, this parliamentarian understands that this is what we mean by ODF. Some may think maybe it is the bush and all, but there's ODF in different perspectives and it should be taken into account. So, my takeaway from this would be, how best can we use this to turn it around into our localized setting? The results may be as they are, but there are different results based on different intentions to pick up. From the GLAAS report, it is widely shared, and we believe in some instances, some donors pick aspects from the GLAAS report and they focus on where they can come into. But at the end of the day, is it intentional? What is the intentional bit we use for this GLAAS report to attract funding? So I think at some point it goes back to us. We've used this platform, they presented the Uganda case at a certain level globally, and how can we use that finding or that result at that level to also argue our case better? So you may think it is thrown the other side, but at some point I think after the results come out, the then what also involves us. We may need also to think out loud. Now, there's a very disturbing finding today that GLAAS is not widely known by most of the colleagues. And I think that is the first step we need to take. How do we publicize GLAAS and its findings amongst us before we expect so much to come out of this report? Yeah, so we need to think about that out loud. I don't think I've left out too much, but on the issue of marrying GLAAS with annual performance reports, like I said, one fits into the other. But then at the end of the day, if we have the results mirroring each other, because the annual performance report will give results and GLAAS will come with the same results looking the same way. But it's still a good conversation on the platform where we're going to take it up, and at least for publicity purposes, since quite a number of stakeholders are there, we will present a GLAAS report there, and people will know that Uganda is participating in GLAAS, and this is how we're going. Lydia is saying that I'm taking too much time. I am still around. We can have one-on-one where possible.
There is a question online.
Oh.
There is a question online. Do we have time, or we take it and respond later?
The question and we'll respond to it, because now we need to review the.
It is a short question. What are the processes of validating the data or ensuring that non-existing data is really sold?
That's for you.
The process of validation.
The validation process, I highlighted about it earlier, that we pick this data from the respective colleagues. But when it comes to validation, we share the data that we compile together before we submit the report. And in this case, I don't want to say that we start by doing ABCD and ABCD, but what happens is that when we pick the data, we will share with, let me say it was share with the different departments in the ministry, and at the end of the day, it is aligned. And by the time we submit as a country, we have replaced all the different respective institutions in the specific data we collected. And time and again, at least when the report comes out with highlights, they are not contested as being not what exactly from the previous cycles. Thank you, please.
If that explains it is concern that GLAAS gives us what we already have. What is new?
Or what we're missing.
So anyway, this has been a very interesting discussion. The conversation has just started. I can assure you, Didier, some of these questions are had. Why they've never been answered, you will tell us. We'll continue with this conversation. Didier is still here, Ivan is still here. Our time is fast spent, but we had to conclude this. Thank you very much, Lars, for letting us. So let's have our break, team. Let's take only 15 minutes, please, so that we come back here. Tom is already waiting, but he allowed us to continue so that we don't cut this short. So let's go for the break. Thankfully, it's near here. We don't have to go out. We can avoid the sunbathing today. Let's be back at 20 past latest, so that we regain some time. Please enjoy the tea. Don't leave any cup standing. Don't leave the advice and but do all of that in 15 minutes.
Thank you.
I mean, said for many times, those some new things. This is specifically like unlike JMP. Take charge. Source. And there can be surprising with there is a consultation, there is a consultation, no one is this is portion. Years. Yeah. Yes. Yes. No, I just. But when you have a value, that is, yeah. No, I agree. Actually, anyone that wants to and it's not easy. Otherwise, that's always like so at one moment. We could stop there. Here are the results. Very good. With the national plan. There is a national plan. It's not totally there, but it's what should have been spent. Same thing. What is the situation that's going through each subsection? What is the situation about progress in the subsection? It is also not our role to say you're doing poorly. It's to show us the first. Then they need to make and if you go forward, it's not the general succeed. And it must not be entirely. But one step to And also related to those when you don't control. Needs to use for their own program.
They still have.
You know what? You were in war.
I think it's not like you. I So, yes. Oh, I don't have It is easier. Because they have 5 grades. Learning platform. Right now, we are getting one. So why is yes.
I hope that I will solve. Thank you. Thank you. And you have to say,
I invite you back to the hall. Please have the very last bit of your copy, come with it to the table. Because our time is back then.
Please bring your tea over. And I request the service provider to take away our tea. We're going to have it anyway. Thanks, members, you're welcome back to the hall. Let's get started and try to finish by 1. Please make sure that you have a cup of tea. Our presenter is going to be ready in the next 5 minutes. So do everything that you'd like to do and be back in 5 minutes. Asante sana.
Hi, Tom.
Hi, Lars. Can you hear me? I see you're still on tea break. No problem. I'll just stand by. Will you be able to move the slides for me in the room?
Yes, I think colleagues, the technical team would do that.
Okay, fantastic.
Okay. Hi, Tom again.
Hello.
I'm still everyone can hear me here. but we can hear you well. And whenever you say next slide or so, the technical team will go to the next one.
Okay, perfect. I'm ready when you are.
Right, in about 5 minutes.
Okay, thanks.
Please bring your tea over. Mr. Slaymaker is ready for us. Let's be back here. Watch in schools.
Yes.
I have the pleasure to introduce Mr. Tom Slaymaker. I hope I said that very well. Who's going to present to us about washing schools?
Sorry, I have, it's rude, and Tom, I hope that he's going to. Tom, I apologize. There is one question that I would like to ask before you take over. I'm very sorry, okay? Is it possible? Just, it's going to be quick. It's one question and answers from the participants. Is that okay? Thanks.
Of course, yeah, go ahead.
Thanks, Tom. I have a question for all of you, including the people who are still taking tea, coffee. We know that we need to collect data for the next cycle of wash account, of GLAAS. Now, who in the room will participate in this new cycle and provide data, help Ivan, poor Ivan, he is the focal point, but he is not alone. Who can commit to provide data to Ivan? Oh, just 2, 3? Ah, yes, please, come on, yes. No? With the conditions. Yes, oh, sorry, Tom, there is one condition. Okay. Did you hear? Perfect. That's good. Thanks a lot for your commitments. And we'll see you soon.
Okay, over to you. So, morning.
Okay, thank you very much. I hope you can hear me. Can you hear me in the room? Okay. Yes, excellent. Okay, thank you for the invitation to join the workshop. I'm Tom Slaymaker. I work on the UNICEF side of the WHO, UNICEF, JMP. I was listening on day one when you were discussing wash in households. And I understand that you discussed wash in healthcare facilities yesterday. So today I'm going to talk about wash in schools. So WHO and UNICEF work together very closely on the global monitoring of wash in these 3 settings. And the important thing is that we produced an update on wash in schools, which came out earlier this year. It came out at the end of May. We produce these updates every 2 years. And this one had a special focus on menstrual health amongst adolescent schoolgirls. So each of our progress updates includes estimates for the core indicators, which are required for reporting on the Sustainable Development Goals. And then we usually have a special focus on something which is new or something which is interesting to the sector. You should also know that we have a detailed document explaining the JMP methodology for producing these estimates. That is available on the website. And we also have what we call the core questions and indicators, which are the recommended questions and indicators for monitoring wash in schools in order to report on the Sustainable Development Goals. So those documents are all available, and I'll be referring to those in my presentation. Next slide. Now, I'm sure you're all familiar with SDG 6, which is the goal for water and sanitation. And of course, we have indicators there for universal access to safe and affordable drinking water and universal access to adequate and equitable sanitation and hygiene. So when we say universal, that really means in all settings, not just in households, but also in schools and in healthcare facilities. So the indicators for WASH in schools are relevant for SDG 6, but they are also relevant for SDG 4. And SDG 4 is about quality education. There is a target there, SDG target 4A, which is about building and upgrading education facilities. And they should be child and disability and gender sensitive, provide a safe and non-violent, inclusive and effective learning environment for all. But you'll see that there's an indicator which specifies many different aspects of upgraded education facilities. And amongst those, we have E, which is basic drinking water, F, which is single-sex basic sanitation, and G, which is basic hand washing facilities. And in the SDG document, it refers back to the WASH indicators. So it said, for these indicators, please use the agreed definitions which are coming from WASH. So when we talk about WASH in schools, we're talking about SDG 6 and also SDG 4. And it means that we need to be working closely between the WASH sector and our colleagues working in the education sector. And of course, in every country, that looks a little bit different. It requires collaboration with different parts of government to collect the data we need to report on these indicators. Next slide, please. So the JMP has service ladders. Just like we have ladders for households and for healthcare facilities, we have ladders for schools. You'll be pleased to know that they are a little bit simpler for schools. There are only 3 ladders, one for drinking water, one for sanitation, and one for hygiene. For healthcare facilities, we have 5 ladders. But they have the same logic. So we're focused on the proportion of schools which are meeting the criteria for a basic level of service. And then we also track the schools which have something, but it is not meeting the basic criteria. So we call that a limited service. And of course, those that still have no service at all. So for drinking water, a basic service means that the school has drinking water from an improved source and water is available at the time of the survey. If drinking water is available from an improved source, but it is not available at the time of the survey, then we call that a limited service. And if the school is using water from an unimproved source, or there's no water source at all, then that's no service. For sanitation, a basic service means the school has improved sanitation facilities, and also that they are single-sex and usable. So single-sex means there should be toilets for both girls and for boys. And usable means that the toilets should be available. You should be able to access them. They should not be locked. They should be functional, and they should provide some privacy. If the school has improved sanitation facilities and they are either not single-sex or they're not usable, then we say, okay, there's something there, but it's a limited service. And of course, if it's unimproved facilities or no facilities at all, then we call that no service. And lastly, for hygiene, basic service level means hand washing facilities with water and soap available at the school at the time of the survey. And hand washing facilities with water but no soap would count as limited, and no hand washing facility or no water at all would count as no service. So this is how we are benchmarking, comparing, and tracking progress across countries, and we try to produce these estimates for all countries of the world. We have estimates in our global databases for about 140 countries so far, compared with households, where we have about 234 countries, areas, and territories. So we've been gradually building up our database for WASH in schools, and that started at the beginning of the SDG period in 2015. And with each update, we've seen a gradual improvement in the data available. So next slide, please. So how do we collect the data that we need to report on these indicators? If you look at the core questions, you will see that there's a lot more detail and guidance on the types of questions that should be asked. And some examples are given which can then be adapted, and they can be included in an EMIS questionnaire for the Education Management Information System. They could be included in a school survey. They could be included in a range of different data collection mechanisms, depending on what is the typical data collection approach that is used in each country. So for a basic water service, we basically have two questions. What is the main source of drinking water for the school? And then secondly, is drinking water from the main source currently available at the school? For basic sanitation, again, we have three questions. What type of student toilets, latrines are at the school? And then how many student toilets or latrines are currently usable? We don't need to know the exact number for global monitoring, but many governments want to know this number. We just need to know, is there at least one toilet for girls and one toilet for boys, which is currently usable? And then the fifth question is, are the toilets and latrines separated for girls and for boys? For basic hand washing, again, we only really need two questions. Are the hand washing facilities available at school? And secondly, do they have both water and soap available at the hand washing facilities? So what this means is with 7 questions, we can get all of the information that we need. And many countries have been able to include these questions in their EMIS or in their school surveys. And so we're confident that it's possible to collect. We've also tried to keep these questions as simple as possible, because we know that in many cases they are collected by school administrators or caretakers who may not have a detailed technical understanding of water and sanitation. And so we try to make sure that the format is very straightforward and that they can fill them in easily and provide consistent and reliable data on basic wash services. Next slide, please. So if we turn to the Uganda country file, and you will see that the country file for schools looks very similar to the country file for households and also for healthcare facilities. We have the same structure, we have the same basic approach, the methodology that we use to produce estimates is very similar. We try to structure it in the same way so that it's easy to read and understand. And if you open it and you look at the data summary, you will see that we now have around 20 national data sources for washing schools in Uganda over the period between 2000 and 2022. The main ones that we've been able to find that have information on washing schools are the Uganda National Panel Surveys. We have the National Service Delivery Survey. We also have data that is coming from the National Microplanning Handbook for WASH in public primary and secondary schools in Uganda. And then we have a few others which are collected less frequently. Occasionally we have some secondary data that comes from UNESCO, UIS. We have some surveys from the World Bank, and we have a survey from World Vision, although the World Vision survey is only for rural areas. We do have some data from the EMIS, but it's important to note that we only had data from 2011. So since 2011, we have not been able to find information on WASH in schools from the Education Management Information System. We suspect that there may be some data there, and that would be a good thing for us to discuss a bit later on. Next slide, please. So in the data summary, you can see what are the data sources that we are using. Are they a survey or an EMIS or some other kind of data collection? You can see what types of information we've been able to extract from those national data sources, and you can see whether they have been used to produce an estimate. So the ones in the square brackets means that we are not using them to produce estimates, and the reasons that we are not using them are recorded in the data tabs. So for example, the UNPS, the panel survey from 2013, you can see there are some square brackets around the values for water there. And the reason for that is because when we received those data, they were very different from the data that we had from the panel surveys from the year before and the year after. So during the country consultation, we agreed that they should not be used. But there may be other reasons that we cannot use the national data. There may be indicators that are not directly comparable, or there may be a lot of ambiguity in the categories that are used. So it's a very important part of the country consultation is to review new data sources as they come in and to decide whether or not they can be used. Sometimes we will switch data sources on, sometimes we will switch them off, and we should be guided by you, by the national stakeholders, and particularly by the National Statistics Office, by UBOS, about which are the most reliable national sources of data on WASH in schools. So we're adding data sources all the time. The estimates are updated every 2 years, and hopefully the estimates are getting better, getting more accurate as we add more data. But of course, the most recent estimates will be very different from the estimates that we produced at the start of the SDG period when we only had 1 or 2 data points. It does mean that increasingly we are able to understand trends, but we still have a lot of data gaps. So from the data summary, you can see immediately we have quite a lot of data for drinking water and for sanitation, but only limited data for hygiene. We have quite a few data points for primary schools, but we have fewer data points for secondary schools, and we have very few data points for pre-primary. Some of these can be disaggregated by rural and by urban, but not all of them. And so we have a lot of data gaps which we want to try to address going forward so that we can produce more comprehensive estimates for Uganda. So let's go through one by one and look at water, sanitation and hygiene, and then maybe we can open up for a discussion. So for a basic drinking water service, we're talking about drinking water from an improved source and water is available at the school at the time of the survey. So you can see the data points in the chart on the right-hand side here. You can see the basic data points are shown in blue. We also have some data points for improved, which are shown as grey circles. And we have some data points for facility, which are shown as crosses. So you can see most schools have some kind of facility. Almost 100% have something. Okay, but it's a smaller proportion which have facilities which are improved. And then when we take into account the availability of drinking water, then the numbers come down further. So you can see those data points from UNPS. You can see that we have quite a large number since about 2010 through to 2020. And that enables us to make an estimate of trends. But you can also see that there's quite a lot of variability in those data points. So in fact, the 2019 data point suggested about 76% had basic drinking water, but the 2020 survey suggests about 42%. So a very big difference there. And this is one of the reasons why we use this linear regression method in order to try and come up with an estimate which takes into account all of those different data points and gives us an understanding of trends. And we can continue those estimates for a number of years after the last data point. So in this case, for drinking water, we are able to make estimates up to the year 2023. But where we only have old data, after 4 years, we can no longer make an estimate. That is the JMP rule. So let's move on and look at the next one. This is just to give you an idea of what we are getting in terms of the detailed information for drinking water. In this case, we're looking at the Uganda National Panel Survey. And you can see we have a detailed breakdown here of the different types of water sources that schools are using. We have data on piped water, boreholes, rainwater, protected springs. This allows us to estimate those that are improved, those that are unimproved, and also the proportion of schools which have no drinking water facility. So that's about 6.3%. We have about 75% improved and 18.6% unimproved in 2020. But then the proportion which are available throughout the year is a little bit lower, so 69.1%. We can see that most of those, but not all of those, are on premises. And we can make estimates then for a basic service level. So that is the proportion which are improved and available throughout the year. And we can also make estimates for the proportion which are not only improved and available, but are also on premises. So quite rich data on drinking water from UNPS. But we only have these for primary schools. And so if we have data for primary schools, we can make an estimate at the national level, because the majority of schools are primary schools. But if we only have data for secondary schools or for pre-primary, then we cannot make a national estimate. And until we have data for pre-primary and secondary, then our estimates for Uganda are not going to be very comprehensive. We don't really know the situation in pre-primary and secondary, but we have a good understanding of primary schools. So next slide shows how we construct the ladder. We first start by estimating the proportion which are improved, so in this case 62%. We then make estimates for the proportion which have an improved water source with water available, so that's 50%. The 12% which are improved but don't have water available are counted as limited, and those which either have unimproved or no source at all, the 38%, count as no service. So this is how we're constructing the ladder in all cases, and we can do that now for Uganda for some, but not all settings. So the next slide is showing our latest estimates from the report that we produced in May. So as of the year 2023, we estimated 55% of schools with a basic drinking water service, 33% limited service, and 12% no service. You can see that we do have estimates for primary, and we do have estimates for rural, but we are missing estimates for the other school levels and for urban schools. The next slide is just to show where Uganda sits in terms of the other countries of the world for which we make estimates. And if you look on the left-hand side, you can see the region of sub-Saharan Africa. You can see that many countries still have insufficient data to be able to make estimates for a basic drinking water service. So Uganda is already in a better place in terms of having at least some data to be able to make an estimate. And you can see that Uganda is sitting somewhere towards the middle in terms of coverage of basic drinking water in schools compared with other countries in sub-Saharan Africa. Next slide. So let's move on to sanitation, and we follow the same logic here. Again, the UNPS is probably the best data source that we currently have on file for Uganda. So we're looking for information on basic sanitation services. It means an improved sanitation facility at the school that is single-sex and usable at the time of the survey. The chart on the right is showing the basic data points in green, and also the improved data points and the facility data points. So you can see immediately that most schools have some kind of toilet, and that most of those are improved, but not all of them are meeting the criteria for basic. The data points we have are quite close together, so we're reasonably confident about our estimates, and we see the trend line since 2010. Coverage has not changed very much. The most recent data point in 2019 suggested about 74% basic services. But of course, we know that the school-age population in Uganda over this period of time has almost doubled. So keeping up with that growth in school-age population from about 10 million in 2000 to nearly 20 million, I think, in 2023 is already quite an achievement. Let's move on to the next slide. Again, this is just giving an example of the type of information that we have in the data tabs. Again, we're looking at the individual data sources, in this case, highlighting the National Service Delivery Survey, which is giving us quite good information about the different types of facilities that are available. But it's a different kind of information. We know the proportion of schools that have no facility, but in the National Service Delivery Survey, we have these categories, which are, is there a permanent facility or a semi-permanent facility? Or in some cases, both a permanent and a semi-permanent, or is it temporary? So this is not really matching the international standard classification that we are using for JMP. So during the country consultation, we try to understand which of these could be considered improved and which ones could be considered unimproved. And there is some information on the condition. The condition here is average, good, and very good. And so we think we can consider those ones to be usable, but we don't have any information really on whether these can be reliably considered to meet the basic service. We have made an estimate, and we include that in the country file, but there is a big opportunity here to improve the categories that are used in these surveys so that they more closely match what we need to report for the SDG global indicators, and also so that they are better harmonized with the information that we are collecting from the other national data sources. When we have different national data sources for the same country, which are using very different categories and definitions, then it makes it difficult to compare them and to generate estimates. Okay, next slide, please. So the logic for constructing the sanitation ladder is the same. We very often find that there's a big difference between coverage of improved sanitation facilities and those which are usable and single sex. So in this case, it drops from 88% to 34%. Those 34% are considered basic. The remaining 54%, we count those as limited, and the 12% as unimproved or no facility we count as no service. And in the last report, shown on the next slide, we can see the latest estimates for Uganda. So we estimated around 75% of schools a basic sanitation service at the national level, 23% limited, and only 2% with no service. And you can see there is some variation between the primary schools and the secondary schools. So coverage is lower in primary than in secondary, and quite a lot lower amongst rural schools than amongst urban schools. But we still have insufficient data to make estimates for pre-primary. Next slide. Okay, so again, this is just showing you where Uganda sits in comparison with the other countries in our most recent JMP progress update. And you can see that coverage of basic sanitation in schools is relatively high compared with other countries in sub-Saharan Africa, but also compared with countries in other parts of the world, which is quite interesting. There are many countries which have lower coverage than Uganda. Next slide, please. So the last one is basic hygiene services, so a hand washing facility with water and soap available at the school at the time of the survey. The national panel surveys are our main source of data that we currently have on file for Uganda. And you can see that there is a steady trend over time. The most recent one in 2020 suggested about 33% of schools had a basic hygiene service, so it's quite low. And we extend those estimates beyond the last data point. So our estimates for the year 2023 are a little bit higher than that. But as we add new data points, we will be able to make more accurate estimates for the current situation. But the data points for hygiene are broadly consistent, and so we're reasonably confident about these estimates. Next slide, please. This is showing you the type of information that we have in the different surveys. You can go in, you can see in the country file whether we have information on no facility. So in the case of the National Service Delivery Survey, we have the proportion of schools with no hand washing facility or hand washing facility that is not accessible. And we also have information on whether the facilities were present with soap. In the National Panel Survey, we have no information on facilities, but we do have a breakdown of the proportion which have a facility with water, and also the proportion that have a facility with water and soap. So those match more closely what we need to make an estimate for basic hygiene services. But again, we only have those for primary schools, whereas in the National Service Delivery Survey, we have information for primary and secondary, and for urban and for rural, but it does not match our indicators as closely as the UNPS surveys do. So construction of the hygiene ladder is very easy, very straightforward. Facilities with water are often much more common than facilities with water and soap. Those with water and soap count as basic. Those which only have water count as limited, and those which either have no facility or no water at all count as no service. And in our last report for Uganda, in the next slide, you can see, based on the data available, we estimate 39%. So we've extrapolated the trend based on the data points. So the last data point was 33%, I think, in 2020. But in 2023, we estimate it will have risen to about 39%. 16% with a limited service, but quite a high proportion. So nearly half of schools in Uganda still don't have a basic, still with no hygiene service at all. And it's very high in rural areas, so 83%. We don't have data for urban. We do have data for primary. So those national estimates are mostly based on primary schools, just 35% with a basic hygiene service. But for secondary schools, we know the proportion that have no facility at all. That's nearly a quarter, but we don't have detailed information for secondary schools on the proportion that meet the criteria for basic or limited service. And we don't have any information for pre-primary. Next slide is showing you where Uganda sits with the other countries. So much lower for hygiene than for sanitation and for drinking water, and amongst the lowest coverage in sub-Saharan Africa. The next slide is just to show you that we are very aware that the indicators that we're using for a basic service are quite basic. These are not capturing all of the elements that are important for a safe and inclusive learning environment. So we want to be able to report on a basic drinking water, basic sanitation and basic hygiene service level in all schools, pre-primary, primary, secondary, rural and urban, as well as national. But that's not enough. So we're also interested to collect additional information where relevant. So once schools achieve a high level of coverage with the basic services, we might consider some additional criteria. So for drinking water, we might start to look at the quality of the water or the quantity, or whether it is available throughout the day. or whether it's accessible to all users. For sanitation, we might look at things like student toilet ratios, we might look at menstrual health and hygiene, or we might look at the way in which the excreta is being managed. So most schools are not attached to sewage networks. They mostly have on-site sanitation systems in sub-Saharan Africa, including in Uganda. So how are the excreta from those septic tanks and pit latrines being managed? And for hygiene, there are many other things we could look at. We could look at whether hygiene is included in the curriculum. Some countries are collecting information on group hand washing behaviors, and also on the availability of menstrual hygiene materials. So there are many additional things that we could collect, and if you're interested to collect them, then we can have a discussion. Some of those are referenced in the core questions document. We have a section on expanded indicators or advanced indicators. And in each report, we try to highlight some indicators of interest. So the next slide just shows, in the last report, we had a focus on menstrual health. We're looking for information on a range of different indicators. And this is an example of one of the indicators that we looked at. So do adolescent schoolgirls have enough menstrual materials to change them as often as they need to during their periods? And you can see we found some data from some countries. Some of these were national surveys, some of them were subnational surveys, and this included Uganda. So in Uganda, we had a subnational survey, which I think was in Soroti, and that collected information. It showed that about 36% of adolescent schoolgirls had enough materials to meet their needs. So we tried to highlight these things and to showcase examples of countries which are collecting additional information which is of interest and is of relevance, not only to the education sector, but also to the WASH sector. And I have, I think, one more slide highlighting some of the questions that we might like to discuss. So we might like to discuss whether there are any new data sources available since our most recent update, or whether there are data sources that are missing. We're aware that we only have EMIS data from 2011, so we would like to know whether there is any information in the EMIS that can be used relating to the WASH indicators. There may be some more recent panel surveys that may become available, especially for 2021, 22, 23, or there may be other national data sources that we could consider using in future updates. And although we've just published our most recent update, we will be holding country consultations again. And so the next slide is just to remind you of the process for the JMP country consultation. So at the end of this year, we'll be consulting on households, but at the end of next year, we'll be consulting on schools and healthcare facilities. And we will be sending out the country files with the latest national data included. And we will be requesting that the WHO and UNICEF country offices reach out to the national authorities, not only to the NSO, to UBOS, but also to the Ministry of Education, Ministry of Health, and Ministry of Water, and any other national stakeholders that we think might have useful information, including some of the NGO partners that might be collecting information. And we'll be always asking the same three questions. Are we missing any relevant national data sources? Have we interpreted them correctly? Or are there any that should not be used for a particular reason? They should be removed or they should be switched off in the JMP country file. So we have this regular process of country consultation. And also we do not have to wait. So if there are new data sources that we can identify during the workshop and you would like us to add them to the JMP country file and you would like us to prepare an updated version of the JMP country file, we're very happy to do that. So please do let us know if there is an opportunity to make some changes right away, and we can share an updated version back with the group after the workshop. But I'd like to stop there, and then maybe we can open up for a discussion or for questions that the group may have about the current estimates and how they've been produced. Thank you.
Thank you very much, Mr. Slave Maker. I find it easier to call him Mr. Slave Maker than Tom, but it's really nice to hear from you, and that round of applause was for you. Thank you very much. Before we reflect, I think let's have the insights from our colleague from Ministry of Education, Mr. Sanya, so that we reflect once. I think that will save us some time and we'll be within the hour. So I'd like to welcome Mr. Sanya. He joined us this morning. I don't know if I know his title, but I'll let him introduce himself, and then he gets into sharing. Has he given you the presentation?
This one? Yes. What? So like this. Washing spoon. Oh my God, plants.
Yes, let's get the purpose. That will be a little. But that was like that.
Do you like to ask them or you just talk about them?
It's Hello. Yeah, I'm a teacher by profession, and teachers believe they need to see the learners when they are talking. So if you talk behind the backs of the children or the participants, I don't believe they are understood. But by seeing them face to face, I will see the expressions, facial appearance, and then we move. So by name, I'm called Sanya Jackson. I work with the Ministry of Education and Sports. And by God's grace, I have a smaller title, Senior Education Officer. That's where I am. And now I currently work with the Special Needs Inclusive Education Department. But formerly, before I became a senior, I was working with Teacher Education Department, because I'm a tutor by professionals. So, having known that, teachers have very many words. We're not like these people of money. They have very few, but we communicate reasonably. So for us, we have a number, that's like we have a number of words. So I'm going to present a few things related to Ugandan situation. We had a similar presentation with the one Slade.
Tom,
The one Tom has, in line with GMP. So I had to withdraw those and align with the local information. So kindly, they are giving me 15 minutes, but I propose that we need this information. So let me keep tapping me, and you keep tapping me, and then we move on. I also got this information on short notice. I kindly request you to be patient with me because I got the information yesterday. And Musa Virungi is in Mecca. He went for hijab. So he told me, please fit in the gap. And as a teacher, always I'm like a soldier. So let me put things, because I was a focal point person for WASH in my department. So definitely that's how fit in. So now, this is just the status from the List of Education Microplanning Handbook 2019. Just give us the status of how WASH is implemented in schools, where the gaps are, and we shall later on agree on what the way forward. So you can see, this is the primary section. I've not in this captured the pre-primary, because when she signaled me on time, said let me withdraw now, the pre, but there is information. I've also shared those documents with the Kenya. So the status now, these are about 162 primary schools in Uganda. By 2019, we captured this information. So that is the total number of schools, and you find that out of those schools, the data, there were 3 million girls and 3 million boys. So if that's that enrollment, this data here I'm giving is not on our EMIS, but we are going to integrate it because it's a working tool designed by Ministry of Education and Sports with the partners. So also you find that now the total number of those drinking water, he has been presenting on water, the water for drinking, basing on those key indicators. Now, these ones here, 7,184, about 58%, they are leaving a gap of, those ones taking water, but it's already a gap of 42%. Are you seeing the gap? There's a gap there when you use drinking water, and water is life, isn't it? So now, you also find that the 9,827 schools with separate latrines for girls and for boys, we have that, but there's a gap of 21. So those who have done, who did those numbers I mentioned, you can get the difference, and that difference gives us the variation. So now the statistics, however, does not give the picture of the quality of the latrines, but they are latrines, isn't it? But the quality, it does not what give. They may be having slabs, or where you just go and squat on it or timber, or where you go in the, but they are latrines there. And this, of course, like I said, that information is reliable and is available. You can get it. Go to the next slide. So, based on that, you also find that about 22% primary schools that meet the national standards ratio. You know, the standard ratio is 40 to 1. A school has, some schools are about 5, 6, but each stands to accommodate 40 learners. Now you see the difference now. When you read through, you find that the difference now, 68 stands for girls, and then you get 72 stands for boys. The problem is not yours. It is not mine. But the population is, you are able to hear about the census report. It keeps on what? We are fertile. You know, God has blessed us. So we have to continue manipulating. Now, as we manipulate, but the resources, the infrastructure does not increase immediately. But we use what is what? Available. So next slide. Now in there, you find that the overall ratio, now the disparities between the district as noted, some districts, for example, you see now Orissa, with gross enrollment of 1,160, this is what? Also mathematicians, 11,000, I think it's 1,000. I told you for me, I'm a teacher, but I'm not a mathematician there. Now, those are boys. And you can see the stats. Looking at the number, you look at the stats, and now divide. See how many children are sharing the what? The stats. Only 200 and what? And the 3 for girls, and only 18 are registered as usable. 208 stands for boys, 15 registered as usable. You can see those ones usable are very few, isn't it? But the stands they are there. That means others are condemned. But they are there in the what? In the school. And you find that children always keep using them on risk. But if NEMA was around to clear them down, if they were in the swamps, they will do the other vice versa and put them down completely. So now, next slide. Yes. Now here, in that micro-planning exercise which was done, you find that related schools that had to meet the standards of 40 to 1 for boys and girls were very few. As per that analysis, 24% met the national girls standards. And the ratio leaving that there's a gap of about 76%. Those are schools where WASH is implemented, but the number of stands are very few, and therefore they also do not meet the what? The national standards. You can also see, of course, the boys and the girls. I don't know who are more stubborn here. Boys. The boys. That's why their number is 78, 79. We shall see. Let's move on then. Let's go to the next. Now here, when you look at now washing, you know when you come to the came also as a blessing. People wash the hands until we complain. But when it withdrew, we stopped now doing what? Washing regularly. So you find that now hands stood at 7,000. Is it 7,000? 91, which is 56%. But it still left a gap of 44%, meaning that people relaxed to do what? To wash. Or there may be facilities, but there is no water. Okay? Or water is there, but there are no what? Facilities. Like the slate mentioned up there. Let me open his online. Just here, I'm fitting in the other is a national data, and this is the local hours. Now, next slide. So now here, I've now closed the chapter for primary, and I'm going to second. I told you I'm a teacher. You know, when I don't see you around, I will change my ways. Now, for secondary, you know, in secondary children are a little bit fewer than those in what? In primary. But also when you go deeper to pre-primary, you find that those ones spend more than in primary and then in secondary. Only that the government has not taken on pre-primary as their own entity to fully support them. Now, when we go deeper to discuss the pre-primary, we find very big gaps. Because these ones, most of the pre-primaries which are independent, not attached to primary, they are even going to the bush around. Yes. But those which are attached to primary schools, they use primary section facilities, including water. And those which do not have, they even walk for longer distances to get what? Water. Now, second way, these ones, you find that there was a total of 1,169 secondary schools in that data period when we were collecting that data. So now, at that time, you find that there were 395,875. These were girls and these were boys who were present at that time. I know now if we go today, this number changes, isn't it? Because this was 2019. If you go there, it has changed. By 2019, I was having 3 children. Now 2024, I have 6. So things were changing. There's no way you say you are studying. It keeps changing. So now, you find that the total number of schools which were drinking water by that time, there were 854. Out of the total number, you see the total number? Yes. Yes. Only 854. What's the difference? Accountants. What's the difference there? You tell us. But that was 73%. And now there's a gap of those who are not taking, isn't it? And you find it's 27%. This thing of 27%, if it was salary, they said they have increased by 27%. Very huge. But here we take it lightly. So 27 creates an impact. And you see those children, they are not drinking water, they're in schools. If they have to get an opportunity of getting water, they have to walk for longer distance. Or the parents pass. But now also ask yourself, if they were in the refugee and host communities where there are no water sources, even the parents will not have to pack for them. Now, those ones who stay around the lake, like my brother there, who stay near the lake, those people who stay near the lake, around the lake, including me, I come from Obusia, let me tell you that. Now, those people staying around there, before you reach the lake, the outskirts of the lake, the water is salted. Now, to access water which is fresh from Lake Victoria, you must drive or ride the bicycle for over 20 or 30 kilometers to reach the water source. And then again, you have to come back. It is to and fro journey. Now, you left someone who was sick at home, he said, please water, please water. How many times, how many hours are you saying on around to bring water home? We have issues now. So, these are examples applicable to areas with emergencies, areas, schools which have salty water. Even when they make a borehole, the water is not used, but it's there. So, all those ones go to 27%. Now, these other ones, of 1,029 schools, with separate latrines for girls. But then you also find that that percentage accounts for 88%. Now ask yourself, where is it? Is it 12? The 12%, where do they go? Those are the people now in a school where you reach and the hosts are disappearing every day. Then the hosts are picked, you go to the nearby bush and the child passes there to the home. When the visitor comes, all those things are applicable. Because this number here of 12% is very big. Those are the ones who are doing direct defecation. And we saw in the data that those who are doing direct defecation are 4%. Think if you listen very well. 4%, even Uganda. You pass, last week I went to Bali. I reached there, it was coming to dark, and I was walking around. My dear, I reached the room when my shoe was full of what? Pieces. Then I said, where did this thing come from? But it was already there. Now that means the indication of direct defecation, open defecation, still stays in Uganda, and wash is the solution. Now, I want to tell you one thing also. Those of you who go to Mbale Park, when it rains, I know there are women who sell whatever, that outlet, when you are going to the other side of the CPS, and it rains, everyone in Mbale releases. Sorry for those who are coming from Mbale. They release the sewage. And it will flow free up to these people where they are saying what? The rights. And that's where it stopped eating the rights from back. Now, because you find, and now when rain stops, you see now the flies moving around like white ants. Now imagine that situation can cause wash issues. And therefore, we have to think further, what next? Here we are talking about ourselves here, but the things we are talking about, they are outside there. Are we together? So we need also to visit those areas. When you go to Kiandong, there are schools which are in the refugee settlement without any home, without anything. But they are waiting for water to come with the what? They call it what? The bows, the water bows. It's the one that comes and distributes. If it doesn't come, my dear, there are problems. So now here, latrines are an issue. And they will not be enough because we are every day generating human beings. Now, still now you find that 40% of secondary schools that meet the national standards at that standard of 40 to 1, they are leaving a gap of 60%. Are you seeing that on members? That means in the secondary there is even more problems. Now, let's go to the next. Just analyzing this because these are the data that we have now. And if we don't analyze them and understand them, you are going to ask me questions. So I better tell you this. Now the separate latrines, and I'm also requesting that group to stop moving. The separate latrines for teachers. You see now teachers here. They are 7-8%. You find the female, go there, and the males go there. Okay? But now what's the difference of those who are sharing? The difference now. They are how many? 22. They are not having their own what? Latrines, but they enter together. You find someone is going to have problems, you also in. Now, those are problems here. In secondary, it's happening. Better in primary. Children will play around. But secondary, all those are adults. You are eating yourself, then the student, your student comes, and after that, they go to the chocolate. They picture you there. And the you can know that name. They can manipulate in any way they want. So that difference is big. Now, what do they do? The male teachers, you find that they were sharing latrines with the boys, whereas the female teachers were sharing with the what? The girls. So the national stance for both stands were below the expected standards. And therefore the girl stance ratio was a little bit higher. Okay? 48.48. It was a little bit higher, but at least fairer. Now when you look at this one, 68%, they are sharing it, it becomes so abnormal. And then also you have to make a line. This is a line. It's not an easy process that you will just plan it yourself and go. No. When the percentage is 68% sharing, you must make a what? A line. And if you have never seen this, go to Ajumani. Ajumani, the settlement, you will see what's there. If you have not seen it there, then you go to Rhino Camp, Tintereko, and then Majoko. You are going to see children, because these are nationals and refugees. And what they have are temporal structures. But they all have to line up in a school. And one school, P3 class, is having 1,800. Others having 200, 2,000. You go to near here, Kamwenge, Rwamanya, settlement. You will find issues here. So members, these are serious issues that we have to present to you, but we also have to look for solution, isn't it? Okay. Now this one here, a total stance for the boys were at that. While the usable stance were at that. That's fair. That's fair. The what? The usable were a little bit, that's okay. Then now this plan, after the survey, the worries now came. And related to school that had met the national pupil standard ratio of this for girls and boys. You go to the next step, next slide, and we see what's there. So now, as per the analysis, we find that only 477 schools, that's the total percentage of 41%, met the national girls standard ratio, leaving a gap of 59. Whereas the boys left the gap of 36. They did not meet the what? The national standards. And now when you come here, you now look at the number of secondary schools with health clubs. You know, in there, in that report also surveyed the health clubs, and they're also there in our indicators. Under the facilities, then under the what? I really those other ones because I want to talk about it, giving them now. Now, these ones who are in those health clubs, the health club helps to promote WASH. Okay? So if a school doesn't have a health club, then it's doomed. There's issues. Children will have opening defecation in the school, on the walls. Yeah, I'm a teacher, but one time when I was doing a teacher training course, I found my colleague doing the same course on the wall. And I ask you now, look at you. I mean, which integrity do you have? Now, near there is a primary school, and we're also sharing the what? The toilet. And the kids are only in the window looking at the what? The teacher. Integrity. But the problem might not be the teacher, isn't it? The nature, how someone is brought up. If someone fails to join the club, you not get the what? The information. Now, those ones who were also having menstrual hygiene management systems, they at least were 50%. Someone asked, do boys also have this menstrual whatever? But we said we all need to participate in it. To avoid the segregation, to avoid the whatever, we all need to be part and part. So now you find that half of them did not participate in activities of menstrual hygiene. So without any system of managing the menstrual hygiene for girls, when it is 50%, 50-50, there are problems. We need that problem to reduce. Fertility goes to 80. You know, with regard menstruation is a big issue which we need to address, and all of us we need it. If you say you don't need it, then tomorrow it will come, it will be for you. Next slide. That watch is very good, it's waiting. Now, to address all of those and implement the WASH in schools, means of education set the standards. And some of the standards fall under those indicators. Drinking water, which other indicator? Sanitation. The other indicator is what? Hygiene, but also have menstrual. So now you find that in government and partners, UNICEF, and all partners who are here, I'm sorry I did not get your introductions. You have really supported needs of education, and we can't wait to appreciate it. These are some of the steps we have taken to implement the WASH in schools. WASH is in schools. Now, schools have been given this water sources, like you are seeing them. There are those ones which are old, they have never stopped coming. The boreholes. This, if you go and research about when the boreholes start existing in Uganda, you get very good information. But if someone asks you who invented the first borehole in Uganda, you will have hurdles. So next. Now here, those are, that's now in the next indicator, where we need to differentiate, isn't it? Latrines in schools. The latrines in schools must be inclusive, and government is implementing the inclusive policy. It must have a stance for children or students or persons with disabilities in the school. And you must have the standard of a stanza 40 learners to 1 stanza. And water. That's why I told you last time when we had the COVID, we were all very healthy. These days I can even eat without what? Washing. I did not wash. Just put my tea and I drink. But the water must be there and so. Now, to address the indicators that my colleague online was mentioning, there are schools, they have water, you visit them, there is no soap. You get, there is a facility, a washing facility, there is no what? Water. But the head teacher is there. He knows everything, the children, there is full structure, and no one will drink water even when it's there. No one will wash. So, and then, let's go to next. These are just the standards that show that we're implementing wash in schools. Now, this is now the facilities, and you can see them. But this one here is very, very important. Sometimes as a teacher, I always ask, why do you have this? This one, why do you have this soap picture? Now the problem with them, there is no empty, okay? But they will be now here they will accumulate deposit, and water will what? Move. And even in Kampala and Ginger, if today when I was coming and near the shell there, when you just stand like this, those of you who saw like the way I saw, the sewage was flowing, entering the road from the other side of the what? Of the shell. Now where is the problem? There are things which are not empty. Okay? But we have a strategy, a framework for emptying in schools. The only issue is implementing it. And so must be there and water next. But you can see what I was saying in the ratios. 1 to 40, but you see these ones. Those are the co-make lines. Next. Now, for hygiene, you find that there is here we discourage where you see a tick. Where you see a tick is doing well. Where you see X is open what? Defecation. And those things are happening. I'm telling you, one thing that made me to move away from class. Every day I go to my class, I want to have defecated in the corner. Yes. And I was asking, who is this stubborn person? Who doesn't know there is a toilet? Every day, and then I told the head teacher, no, this time, I'm not entering that class. And by the way, take responsibility, you cannot ask the children. Tell them, okay, bring it home. I don't know you are human. Why are you sending the child to remove when you are there? So sometimes I participate and remove. I removed it 5 times. Then I put my hands up. Because of this open education, but later on we learned who was doing it. But of course I cannot be. And it was sorry. Now, this part here is very important. Okay? This part here is very important, where we use the sanitary pads, and most of the schools do not have the disposing facility. They may, but finishes it. It's not there. What finishes it now? Incinerator. So most of our secondary schools do not have, and most of our primary schools do not what? Have. Now, you go and you find in the dustbins where you find the usable that what pads. They are thrown everywhere. Behind the dormitories, you find them what? There. So there are issues. But we are saying for a hygiene school, all this should be what? Observed. And even it doesn't stop here. Children, you have children who are starving, they don't want to bathe. And these days we adopted the issue of maids. They will get water and smear on them. Then you come, they bathe. They must use water, soap, and everything. But there's also school feeding program which is integrated in this. But our maids, what they do, you take milk, they drink, they get water out, and they give the children. So even the defecation will not be good. Because there is incomplete processes in the human being. Move. Now, thank you very much for attending the symposium last year and this year for washing schools. This symposium came in as a result of some of those gaps that I have mentioned. That now we brought you on board to discuss issues at national level to address them. And you find that all of you who are here and those that did not put participated. But the reason was to observe this, to overcome this, no service. Okay? This is what we have. Those three indicators, they had also questions, isn't it? There was why we said limited. There's why we said no service, but there's also what we said basic. So the issue of no service had once bring us problem in schools. And we shall continue having the symposiums for publicity, we have wash runs and everything, so that we find that there is sanity in our schools. So Minister of Education is implementing what you people see down there, the WASNet, the water in what? Water for people, the IRC, and many of you, our work is to implement in the field. Because you bring the money, we can't just sit with it. You give us money, we use it, but also produce what? Results. Next. Next here, now. This is now the EMIS, which my colleague talked of. Now the EMIS in Uganda, IRS, do I have IRS members here? Yes, you clap for yourself. Now those ones, you clap for them. I have quoted them there here because there's a document that came with the action plan. But in the action, they raised 6 areas. And those 6 areas, number one was to set a minimum standard for what in schools. I've been presenting you the minimum what? Standards. It was their opinion, but we implemented. And they did not go alone, they did it with all of you. So, but I just said, we just put on the you, but you did all of us. Then the other serious issue they mentioned to be implemented was monitor what in schools, cover it through education management information systems. Now, this is the system. Have you prepared the whatever? Now, I will ask you, these other ones, we have implemented all of them. Engage with the scale, wash in the programs. That's what we are doing out there. Contribute evidence on the impact of WASH in school USAID and the other partners. They have done this one. I was even invited in Masaka. Masaka, Gomba, where in the same activity here. And then raising the profile of WASH in the school program. The international presentation gave us the what? The profile. Now we are also integrating with the national one. So now next, move next. Now the purpose of this, okay, you laugh at this, don't know whether it is being done. The purpose of this is to integrate information related to the management of education and sports systems to make it available. The problem is not, the problem is availability. I only given him the what? The password. Who of you can access the areas of ministry? But I have given him only one password to access, and when we finish, it will log out. So there is a problem in this purpose. We need it to be available in a comprehensive yet specific manner to MS users. All of us were users, isn't it? My brother was complaining of having many tools. Therefore, we don't have universal data. And because also we don't access this. The people who do the top management, the inspectors, Minister of Finance, and the partners, all those who are donors, okay? They are supposed to access this. You move and visit this. I pray that watch to stand there for a while. Now, these are objectives. I will not read them. It is moving very fast. We shall go to church. Now, these are specific objectives. Colleagues, we shall share this presentation. Let's move next. Now, that one takes us to questions in the EMIS. For those of you who went to Zanzibar, what's Zanzibar?
Yeah.
For WASH.
Yeah, that's very good.
And there was a recommendation that Ministry of Education should now integrate the WASH in schools into the EMIS tool. Okay? So when Musa represented us, when he came, we convened a meeting and we said we need to start with something. But he had told me of this meeting, or that he don't tell me that the dates were this. So what I did, I engaged the statistician there that we integrate a few. But from here, we shall agree what next should we put, because it's not complete. You open the MS. This is just a picture, but you can open the what? That MS thing. You know, we shall not disorganize people online. But it's really very key. That's why I wanted to show you that we have started implementing the recommendations made the other side. So you can get where are you? Where are you? You minimize that. You tap upload. Yeah, upload the other side. MS data upload. Then, yes. So now this is how the system works. But now this system, we have been facing problems coming from you partners. Not necessarily you, but their partners who have been working with. Every person comes with a tool that please make my tool there. Make my tool there. Now we are failing because you come with Washington tool of questions, you say integrate. You come with the questions 8 in the refugee and the cost, you say integrate. You come with the, now is what we call the CFM TV. Then we say integrate. Then we have the DRSM for Directorate of Education Standards. Now that's confusion. But what we are doing is to pick what is related so that we harmonize and we don't leave any other question. In fact, if you have those tools and you're still waiting, you have them, just bring them. We shall convene and we see. The ones of you as C, is it? The CTV, yeah. The teacher, something module, something. That one we have now integrated. But we have all picked the indicators that are related to all of the other ones and harmonized. Then you find the human and inclusion also comes with another set of 20. Another one has a set of 28. And yet, even if we use the international one, the Washington tool, it has only 6 questions. Now, we have gone and multiplied the questions to make it 24, 28. Now, we want it all to land in what? MS. That's where problems are now. So now, how does this one work? You update. You just come here and then update. So, you can read it's there, it's downloading, but I think no. So I wanted where now it's loading. Because I wanted to see what we have put there is water. It is a sanitation and a what? Something like that. But there are very few questions which need us to integrate. So now you find that there's a drop down. When you say water is food, there are questions. Then you ask, does this food wash hands? Do they have water to wash hands? Yes. But is there soap? No. But whatever response they give is what you do what? You tap on. Then you do what? You upload. And at the end of the day, it's taking long.
That is very heavy.
It's very heavy. So at the end of the day, if I wanted children who are in refugee, living in refugee camps, and they are not using the water, I want to go for that section. This one's not using the water, but they're in refugee and host what? Community. And the data lands. I want those with disabilities, but not all disabilities. Those who cannot walk, who have difficulty in what? Walking. Or I need those severe. So you find that it only gives me what I ask for. Now in this My computer has been so fast. I don't know why yours. Is it from Iraq? Where? Mine was very fast in this, but okay. Now it has grown. It was because I was what? I was near. Because I wanted to just drop for me to show the questions which are there. If it fails, then I will have to fail here also to explain to you this, but I cannot fail. I'll show you how it works, okay? And I request you to continue engaging with the means of education in line with the MIS, so that you can integrate whatever you are having as problems here, we integrate it in the what? In the system. Then we move on. So if that one has failed, you go to next. Then I conclude. You have two computers. One can serve the purpose and the other also download its own things. So, colleagues are there. Let me hope they are not complaining.
They are complaining.
They are complaining. Oh, sorry. I'm very sorry. But I'm winding up. So now, from all that I have explained to you, those are issues that are affecting WASH. It has come. Yes. Oh, this is the screenshot.
It's a screenshot.
Okay. Now move next. Just move next. I will show you how to do it. Each of you. Now, those are the reasons why we need this MIS data thing. We shall share this one. But however, we are saying the last one, collect and provide information that will provide a basis for determining impact and effectiveness of projects and programs. When you set programs, you need to determine the progress. How is it doing? But you will come back to the MIS and you log in. In the first month, how did it work? After the quarter, how did it go? Is it okay now? You want to flash us back? Yes. Maybe you share it. Now he has succeeded. Kindly people online, we are about, but wanted to show the MIS how it operates. Just briefly, then we move on. So, did you now you see our area is here. Are you seeing this? Tap there. So when you tap there, that's water and sanitation, right? So we have managed to slot in water and sanitation. Because if it's not slotted there, no one would agree. I know those people are very stubborn. But once it's there, now we can say, last time we put one question. Today we want to add more. So now what's there? The question is talking about the main source of water, which is used. The main water purpose, the main water by type, the distance, something like that. So what you do, you just tap here. Tap there. So when you tap there, you go and respond to answers. So you can now, there's a block answer here. Okay, you have blocked. According to the question, what's the main source of water for drinking? They pick from there. Then you tap. You can tap something there. And then you go next. Main source of water for other purpose. You tap something. Are those the things which we are using for as source of water? Borehole, pipe, but there's also deep taps. Then you go next. You go next. That question you also answer. Now after that, you save. So once you save that, the information has been what? Saved. You can see the responses, isn't it? So when you are now looking for data, you now go and analyze. Pick all those who have said tip it up and you move on. Then it will be done like that, like that, like that. Let's stop that one. And I summarize the last point. Thank you for succeeding in that, Elise. Move on, that one I talked about it. Those are challenges. These challenges are the ones barring us from getting data now for the MEs at hand. One, like I told you, even today, you will bring the tools. You need them to be harmonized. And yet we need data. And these things started in a COVID time. Data became a problem. Then for Ministry, the first lady said, all data must be channeled to planning. No other department should gather what? Data. And you cannot, of course, go against that. You have to follow the what? The system. So now, you find that we have inadequate training to the MS users. Just you can, if they say now this one has been now, is now being implemented, scaled up, but the users do not know how to use it. It's going to be a problem. So we need the money, kindly, those who are interested in this, take it up. So we can have people train, and we have this system used everywhere. You can even log in, because this system is used by the schools, the head teachers, the district. They just give you the what? The password. Then you enter the data as you want. The organization, you can enter all the data you want by yourself. So you need to take it up. Next. So you find that there are also issues, scattered data brought by education development partners. It's an issue. Today you're working with this one, you say, now I have this, that. Tomorrow, another partner comes with what? Data, because that's your area of interest. You're implementing a project, and if you don't do, you have to pay back people's what? Money. And you cannot also refuse when you have come with it, the data that please this, we do 50-50, isn't it? So that we balance, you maintain the job. We also balance ourselves, we maintain our job. Where you can go and defend before the senior management. Yeah. And then you even have not all the wash in the schools indicators are covered in our system. What did you see? You saw washing your hands, isn't it? Did you see toilets? That means they are there. But did we see the hygiene, the menstrual hygiene? Those are issues which are still there. Let's move next. And now this will be in our discussions. What should we do? Okay, move. Those are internal abstract, education abstract, 2017, I've shared it. You will open and see water wash in the schools. Is for pre-primary is there, for primary is there, for secondary is there. You get interested in those data, but this, you know, this was from UGOS 2014, and yet you have just done another one, UGOS, but this is education abstract. Move next. Oh, thank you very much.
Being a teacher is an interesting job. Teachers never run out of energy. And yeah, thank you for energizing us. And
the other one?
Batteries on again.
Take the other one.
I think the
Because I don't think that they will hear.
Anyway, it's already lunch time. Okay, it's already lunch time, and I need to get consensus. We have two presentations to reflect on, and we already have our coupons. That means lunch is ready. Let's agree. Can we extend for another 15 minutes for reflection, or should we come back early from lunch and start with the reflection? 15 minutes. The reflection shouldn't be longer than that. I'm going to be very democratic and let you. How is that for Mr. Slavery? What should we do? Reflect now? We can extend a little bit and have a late lunch, hurried lunch. Yeah. So okay. So let's have a reflection. for another 15 minutes. We'll break off at 1:15, and then we'll cut our time for lunch short. Thank you very much for your understanding. Wow, where do we start?
There's a hand.
We'll start with an online hand. Mr. Birungi Musa.
Yes, Mr. David, you can.
Please unmute Mr. Musa. Oh, he's doing the hand. Yeah, he has not yet had the time to so but we wish him luck. Is he there? Okay.
Yes.
Is he coming home?
Yes.
There's no microphone.
He's unmuted.
Yes.
He's unmuted.
I'm there.
Yes.
Okay, good.
Okay, please, give us your reflection. We're waiting. Haji Sulaiman Amda. Haji Sulaiman Walugendo. Did you want to say something? Okay, maybe we're having a few hiccups. The time between Ginger and Zoom is lagging.
Here. Now he's in a bus.
Wow. It's not here. Perhaps they type in the chat if it's not, if the volumes are not working. Okay, in the meantime, we can have reflections in the room. Once we get that crack on the internet, we'll switch immediately. Yeah.
Thank you very much, Mr. Sanya and Tom, for those insightful presentations. Related to the JMP presentation on basic drinking water, also it moves into the basic sanitation service. Why do we have declining levels of access? Is it because we're having new schools being entered into the database? I didn't quite get why. At least for the schools, I mean, say maybe we have new schools, increasing population, but that will be catered for by the people to students ratio, which again is not reflected within the JMP. Wanted to understand more on why we have decreasing level of service when it comes to basic drinking water. Like 2019 being 76 and then 2020 being 42 is quite, I didn't really get that. And then my other question was on why would we have the national level service looking better than the rural, urban, primary, and secondary level service? I thought you're aggregating data from the primary school and the secondary school to generate the national level service, but you have the level of service within the schools being low, and then at national level, it's high. How does that come about? And then for Ministry of Education, if JMP was accessing the MS before 2011, what then happened? What has changed? Is it the same data still being collected? Why the restrictions? Well, despite the problems that we currently have, why the restrictions? Thank you. And one more, when we say improved, when we say basic water for schools, is it on premises or is it beneath kids go and collect the water from wherever and have it in jerry cans on premises? If at the time of survey they find it at school, it would be considered as basic. So what do we mean when we say basic water for schools? Thanks. Okay, thank you, Diana. Thank you, sir.
Thank you so much. I want to learn from the last statement. When we say this percentage has water at premise, and we say the other percentage is lacking, and we break down the lacking. Is it that there is no water or the water they access is not premise? It will give us a better maybe planning or action level. Then we also say the emis. I think the biggest problem at times of these management information systems is updates. Who is responsible at update? I think the responsibility of the update also promotes the reliability of the data that comes from the system. How often is it updated? And then after all that done, do we do the analysis? And what is the frequency at which we do the analysis? And if we have done the analysis, what happens of the result? Does this result tell me that, you know, you must put a policy that solves X, Y, Z? And we implement the policy, we implement the projects, but as a result, maybe as an outcome of the aims. Thank you.
Thank you. Presenters, mine goes to the Mr. Saga on the issue of data tools. You kept on saying the thing is that the system they got a problem, they get problems because most sector players keep on coming with different data. I thought as a government entity, we should be having standardized tools which capture the data and you want to get from other players. The other players use your tools to help you collect data. Maybe I just need some clarity. Thank you.
Thank you. My name is Simon from UNHCR. My question is, why then can't we put these questions in line with the GMP? Because we will still be reporting anyways. There are 7 questions the other side, and I see through here. Can we just have the 7 so that we have one data source? And then the second thing is, for refugees, if we put it as data for the district, it has a way of skewing the entire data. I would recommend that for the district to benefit, we should be able to put somewhere to show what is in the refugee settlement and then what is in the host community, because it has a way of changing the resource allocation for the district. Thank you.
Thank you.
Thank you so much. Thank you so much. My question was to our Ministry of Education about data. How often the Ministry of Education updates its data? Because this data is in 2019.
Thank you. I was concerned about the fact that urban is into the future. When we disaggregated, urban seemed not to feature. Then secondly, to Mr. Sandy, it's in regards to the three-star approach, the three-star WASH monitoring that Ministry of Education has within the policy and guidelines. SDG in partnership with GIZ went ahead and used that guidelines to develop the WASH in schools monitoring tool, which was actually seconded by Ministry of Education. I don't see how it marries into the MIS. Now, those other tools, I think it's very key that we find our way, because some of us are sub-regional of cities. How do we feed into this thing? Because we are just more block out of the big picture. How do we ensure that we are monitoring, but also feeding into the Ministry of Education system?
Thank you, Mr. Sanya, for your electric presentation. I think you must have been a history teacher or CRS. Late when I was watching you present, but thank you so much for the presentation. I would like to join my senior boss, Simon, in speaking for the refugee context. You will forgive us for being more inclined for speaking for the refugees, because in the era of the SDGs, as we are advocating for leaving no one behind, we have 1.6 million of them in Uganda here. And today, again, it is very important for us to acknowledge that today in this country, we are celebrating the World Refugee Day. Today, the national celebration is taking place in Rhino Camp, and we have dignitaries there, the State Minister for Refugees is there, and so many other stakeholders. So, for context, and from my experience, this is just a common reflection. From my experience in the refugee operation, I have noticed that institutional wash have been sacrificed at the altar of community wash. And this is attributed to the dwindling of funds. And UNHCR has done its level best to maximize fund to the priorities. And they have so many competing sector priorities. And even within the wash sector itself, we have so many competing priorities. You will now have to choose between maximizing funding to supply water, maximizing funding, supplying basic sanitation services. But at the end of the day, you realize that most of the funding is maximized to supply water and very little to sanitation. And so in the refugee settlements, for context, it is important to acknowledge that refugees start from a point of disadvantage. So you go to primary schools, you will find that the primary school has over 5,000 learners. And the number of instances are 10 or even less. And of those, some are filled and they require urgent dislodging, or they need to be condemned or decommissioned. And so it will be very important that as the Ministry of Education and Sports and as stakeholders, we always find an alternative set of indicators or set of data for the refugees, so that these 1.6 million people are also looked at and taken care of. That is just my humble appeal, so that their data is not lost in the general theme, that this is what is reflected at the national level. Thank you.
That's a very clear appearance. Wind it up with Catherine's contribution, Kate's contribution, and then we'll get a quick reflection from Mr. Sanya and from Mr. Slaymaker, and then we'll go for lunch.
I'm also considering, I just cut it short to make it cake. But anyway, my name is Sakat. And mine is about the MHM in menstrual hygiene, management of menstrual hygiene and health missing out in the indicators. I don't know what Ministry of Health is doing to make sure that they compile or capture such information, because you know MHM is a key component in our institutions, especially schools. If I remember vividly, Tom also mentioned that it's still a gap. Yes, it's still being under development and all that. So how do we accelerate its development as in the MHM indicator, so that we can capture and report on it? Because even in the GMP data, I remember that exercise we had with GLAAS, it was missing out. So that's one of the data sets that we missed out in that. So it goes to Mr. Sanya. Thank you.
Thank you all for your contributions. Mr. Sanya, you'll reflect in a few minutes, 3 minutes, something, and then Tom will reflect, and then
One reflection from the Ministry of
okay,
Education.
okay. Do you want to read it?
So I read on behalf of Mr. Birungi Musa from online. He says, thank you very much, the GMP, for the detailed presentation, and it is going to provide the necessary guidance to the Ministry of Education and Sports. As Ministry, we have been having issues around data, and that is why we innovatively came up with the micro plan as an interim measure. But now our education monitoring information system is up and running. We contacted the EMIS team to ensure that the WIN-S indicators are captured. Also, Ministry of Education and Sports recruited staff purposely to support our schools' head teachers and DEOs and EMIS, and we want to use this opportunity to build the capacity of the EMIS personnel to incorporate all aspects of WIN-S indicators. Lastly, I want to appreciate all partners for the great support towards WIN-S implementation. So thanks for this input.
Okay, we appreciate that, Mr. Sanya.
Thank you very much. Because sometimes I always ask my participants to answer. So, do I have someone who have an answer? So if there is no participant answering, I want just to, first of all, on EMIS, I already showed you one component where we wash water and sanitation. But there are other components, like for menstrual, I have it here on, it's on health and meals. It is accommodated in the health. So all issues of health, including the menstrual hygiene, they are getting part of it here. My dear, the number of questions. The refugees, we have a component, because we already mentioned it, for the purpose of this meeting. I showed you how to wash and in line with the concepts of what we are studying. But there's a number of things which we are yet to learn. I want to request that some of the responses which you need me to give in terms of restriction, strategy data, why did you stop all this? I'm going to make a write-up. And I will send through Bulgaria, because I have the what? The address. However, I want to appreciate you for really opening our minds into those issues that we had not catered for. And I also request you that whenever you call for such meetings, they always you call of me. Then you call of me, then you come and go on your legs where necessary, and where not necessary, of course, we did. So the rest of the responses, I pledge, I will harmonize them and through Kenya, I will send them. Thank you.
Thank you very much. The beginning of a long-standing relationship with you, Mr. Sanya. We need champions in that part. So let's have Mr. Slaymaker responding, and then we'll really go for lunch.
Okay, thank you very much for a good discussion, and thank you also to Mr. Sanya for a nice presentation from the education sector side. I think, one reflection is that I think, we have already captured many of the existing data sources. So I don't think anybody said there is a great data source that is not included, but we know that the existing data sources are not giving us everything that we need. So I think the discussion can move on to how do we fill those gaps. I think the EMIS is a great opportunity. There is an opportunity to collect data systematically and to report on it more frequently and to align it with the core questions and indicators that we've been talking about. But as we've heard, it's not yet there. The data is not yet being regularly produced. But I hope that in future we'll be able to draw on the EMIS for the JMP estimates. just to respond to some of the questions. So why is the service level declining? I mean, the national data sources really suggest that basic drinking water has been declining. Basic sanitation has remained largely unchanged, and basic hygiene has been increasing. So it's a mixed picture. The JMP is really just analysing the data. We do not try to interpret the reasons why it has been increasing or decreasing. It's a starting point for a discussion, and I think that the idea is the sector should be having a discussion about what is working, what is not working, and what we need to do to change it. The national versus urban versus rural. Our estimates for national are usually based on school levels, so primary and secondary and pre-primary are combined to make national. Very few national data sources are disaggregated by urban and by rural. So sometimes when we have data for urban and rural, they will not match with national. That's just because we have a lack of data on urban and rural. But national should always correspond to primary and secondary and pre-primary. And then there are some questions for EMIS which have been answered. So where we have information on the location of the water sources, we do try to include that in the country file. So a basic drinking water service just means improved water source and water is available. It doesn't mean that it has to be on premises. So on premises is important, but that's an additional piece of information. It's not required for global reporting, but as we heard, it is part of the national standards for Uganda. So I think as it's part of the national standards, then we need to make sure it's included in all of the data sources, including the EMIS. And then there are some questions about refugees and host communities. We find it's very difficult to get separate information for refugees and host communities. I cannot think of any countries where we have this information for schools. I can think of some where we have it for households, where we have information that's disaggregated for refugees and hosts, but not for schools. And so that's something that it would be good to talk about. How can we collect that information, and how can we build in those disaggregations into the existing data sources, whether it's information collected by UBOS or through the EMIS. And then I think there was one more on why is urban data missing? Urban data is often missing. Many countries in the education sector data do not systematically disaggregate urban and rural in the way that it is systematically disaggregated for households. So only a small number of the data sets that we have on file have a disaggregation for urban and rural. And I think we should discuss whether that is important and whether it could be easily added, whether it's possible to get information at the individual school level about which ones are classed as urban or rural, according to the UBOS classification. But this information is often missing in many other countries, and it's also not available in many of the data sources that we have on file for Uganda. But where we do have that information, we do see that there's often a big difference between urban and rural. So it seems to be an important source of inequality. So if possible, I think we should recommend including that disaggregation. I hope I answered the questions, but I just wanted to say, as you are breaking for lunch, I think this has been a very useful discussion. Thank you very much for inviting us. And I want to say the door is always open, so please do feel free to follow up on specific technical details or to request additional support if you would like it, to try to adapt the guidance that we've developed at the JMP and to apply it in the local context in Uganda, including the ongoing development of the EMIS. Thank you.
That's a vote of thanks.
Just one, two.
KFW had been talk. I don't know what.
Sorry?
Sorry.
If KFW had my brother say refugees are not anywhere. We have a whole secretariat at the Ministry of Water. And that coordination unit is a national coordination unit headed by an assistant commissioner called Engineer Richard Matua that coordinates. But also it does piped water supply system because of the mandate of Ministry of Water in refugee and host communities. Where today's day is being hosted, about 2 to 3 months ago, we commissioned Rhino Camp, Fecal Sludge. And 2 weeks after that, we launched Rhino Camp, piped water supply system for refugee settlement and host communities. All these big programs in the northern Uganda are financed by KFW. We even have progress reports quarterly. We also have, because it is done in phases, we also have completion reports, project completion reports of each and every phase. So to me, as Minister of Water, particularly rural and urban, we cannot say refugees are aside. We can say refugees are at our hand, our thought and action.
Thank you for the assurance. I think then we need to see more of these stories. When somebody else says they haven't seen, it means that things are happening. It's a bit like smiling or winking at the little in the dark. So please, when you light a lamp, put it up on the lamp stand so that everybody sees that lamp.
So in fact, to the annual report of 2024, the refugee performance has chapters in every PR.
Please share. Please share the report. All the people here must know that refugees are top on the agenda. With that very kind point of conclusion, let's go for lunch. Please tell your stories. If you do something out there, let people know. Don't be afraid to blow your trumpets. Tell us about it, be in every conference, be at every exhibition, be there and tell your story. Not so? Let's have lunch. We're going to have a lunch of just 30 minutes.
You don't let me talk, but you need to be detailed.
We shall see the flexibility about flexibility, but let's keep the lunch trail, please. The visas are at the exit with Hilda. The online people, please have lunch. Enjoy your lunch. We shall be back at 2:15. That means 45 minutes. Thank you all for your active participation. Go and re-energize.
Yeah. So they went to the district. There was no.
Anticlimax. We are back. Welcome back. I know, but I told them to come back in. No, I don't think to come.
You know what? Very hard. Mobilizing, stubborn. Mobilizing others.
Is that how to explain?
I'm sorry. Because I'm seeing.
We have only one presentation, right?
Hey, so you're leaving again.
That's why I want to see. Yes. So we keep it short. So that I think that's bits of change.
The sweets of genius.
You want
Tomorrow, I get no break.
Stephen one there. It's just they always ask me, yeah, what?
We're back. We're waiting for Martha. Good afternoon. Are you well? Did you have lunch? I don't think I saw you there. I probably wait for the dish that you didn't serve. Very good. Did spend a lot of time with the show. Martha, Madam, Martha, the melon. Melon, Martha, Members, welcome back from the lunch break. I really hope you did justice to the room. All the food did justice to you. Please, every time you have the opportunity to tussle it with a plate of food, do.
Mr. Sanya killed our appetite for lunch.
I thought he triggered it.
No, he killed the appetite.
We need passionate wash ambassadors like Mr. San. And he already offered that whenever you need him to talk about these things, he will be present. So we're happy to at least have an ambassador from this gathering. If there's any good outcome from these 4 days, we've recruited one more ambassador. Yes. Okay, it's 2:30 exactly by my watch. And I think we're ready to start. And we're going to have very short, where people are here. So we're going to have 2 short presentations and hope we can give everything, the presentations and the reflections within the hour. By 2:30, should be starting to wind down. Mr. Wandera accused me of restricting the eating and not restricting the talking. Now I'm going to restrict the talking.
I just need to try.
So we're going to restrict the talking so that we can break off early and do some more eating in form of eating. Okay, welcome back, and I'd like to invite our next presenter, Miss Hayes Damiano. So we have so many varieties of barrier for effects. Aids, Ketty,
For today, I'll be Kate. Good afternoon, everyone. I want to, I hope I'll fit into the shoes of Mr. Sanya, who kept us energized. Let me stand this side. I know now that we have eaten, the calories might take a toll on us and we end up dozing, but don't worry, I'll keep it short. I'm not, just a disclaimer, I'm not a tutor. But I'll try. So we want to talk about the WASH performance measurement framework that we use within the Ministry of Water and Environment. Maybe we can go to the next slide.
Yeah,
it's coming. Maybe if you see your neighbors not yet returned, give them a call, tell them we've started so that we meet the time of Lydia. So as we wait for the slides to move, oh, it's back. This will be our outline. We're going to talk about the WASH indicators, which we already dived into. Specifically on day 2, we dived into them in detail and how, when, and who does the data collection within the Ministry of Water and Environment, then the challenges we face, and then the reference documents. So as the ministry, we revise the performance measurement framework so that we align to the global indicator, that is the Sustainable Development Goal framework, to enable tracking both the national and international targets. So we focus on 6.1 and 6.2, which talks about sanitation and water and sanitation for all. And we've continued to hold annual performance review meetings, where we are able to report about these indicators under SDG 6.1 and SDG 6.2. So we go to the water supply. Oh yeah, I know we are all now very conversant when we talk about basic water, safely managed water. But as the ministry, we also go ahead to do the village coverage as a directive from His Excellency the President. So when we are looking at basic water, we talk about we are tracking the percentage of population using improved drinking water source. And then when we go to safely managed water, we are talking about the population using safely managed drinking water services located at the premises. And then for the villages, we talk about we track the percentage of villages with a reliable source of water supply. We also we capture the PROPUA. By PROPUA, we talk about the percentage of towns with PROPUA facilities where people pay less or equal to the household connection tariff in a service area. We do this mainly in the small towns and rural growth centers. Like my friend, my colleague, Chibelu will explain further, but we also track that, the PROPUA. And then functionality. And when we talk about functionality in rural, I talk about water sources function at the point of spot check. Spot check, I mean, when I go to a borehole, I pump it, water has to be there. Or when I go to a tap, I open it, the water is there. So that's the spot check we are referring to. Then when we talk about the small towns and rural growth centers, that is the piped water services available. In urban, the mandate of the Urban Water and Sewerage Department is to provide water in small towns and rural growth centers across the country. And then we also track the national water. National water looks at cities and municipalities. So we talk about the percentage of piped water services available in those cities. We also look at management. In rural, we look at the percentage of water points with active water user committees. Though right now we are moving into area service management. Madam Edrida stepped out, should give us a detail of how we go about that. But we also, in small towns and rural growth centers, we look at the percentage of water schemes with formal contract-based management structure. That is the water boards, the area service boards, and all that. Now we can move to the next slide, please. Then when we talk about the sanitation and hygiene indicators, we look at the basic sanitation. I know now we all know what basic sanitation is, percentage of population using that improved sanitation facility non-shared with other households. So we track that in our performance framework, monitoring framework, and then safely managed. We know sanitation services where excreta is disposed of in situ or off-site, treated off-site. So we look at the entire service chain of sanitation so that we can track the safely managed sanitation. And then identification, percentage of population practicing OD, identification. So for hand washing facilities, we look at the percentage of populations having hand washing facilities with soap and water at home. Hand washing facilities tracking usually is problematic because it's a proxy indicator, but what we look at is to make sure that in a homestead, there is a hand washing facility with water and the soap. Maybe we can move on to the next. So I want to take us through how the data collection process goes on within the ministry, how, when, and by whom. So the how for the water supply, we give out forms to the district local governments. We have form 1, which looks at the point water sources. Then form 2, which looks at the piped water sources within the rural centers, because we also construct gravity flow schemes and also large solar mini pipe systems, large or small solar pipe systems. And then form 4, which looks at the operation and maintenance. And how we analyze this data for water, we analyze it in the water and water sanitation database. The ministry developed the water supply database in 2010. So we keep updating that information on a quarterly basis for water as it comes in from the district local governments. And then for the urban side, when I say urban, we're referring to the small towns and rural centers. These forms are submitted to the M&D officers by the commercial officers. The commercial officers are attached, they're at regional level. We find them at regional level, so they send in that information, which comes to the staff at headquarters, and there's also a database on that which tracks the urban side. And when it's done quarterly for rural and monthly for urban, that is water, when you look at the water indicator, every quarter districts reports for district local governments have to send in their quarterly data on water to the rural department, which is now fed into the rural water data, the database. And then for urban, it's on a monthly basis. Who does that? Like we said, we have, we work with line ministries, so we work with Ministry of Health, Ministry of Gender and Labor, and they second staff to the water officers. So we have health assistants who do that, and we borrow those from the Ministry of Health, from the DHO's office. We have hand pump mechanics, those ones are specifically under the district water office, and then also ADWO, that is Assistant District Water and Sanitation Officers in charge of, maybe we can go back, please. Well, yes. Yeah. And at regional level, the staff are at regional level, the M&D officers who send to the headquarters. Then when you look at the sanitation part, we do it annually, and how we do it, we work with Ministry of Health and send the environmental health data collection forms, which we analyze in Excel. There we work with our counterpart Ministry of Health, and then we are able to aggregate this data and come up with the percentages. And who does it? We have the village health teams, the health inspectorate staff at sub-county level, and also the ADHO is the one who signs on them. And like I said, Ministry of Water and Ministry of Health are in charge of that component. Maybe we can move to the next. We have a few challenges. They're not many, they're quite few. We've been in a paper-based data collection, and you know what happens. Someone can just, you don't know the authenticity of the data. Someone can just sit under a tree and fill in that data. So we are faced with that, but we are with support from ministry. We're working with Ministry of Health and support from UNICEF. We are now having the WASH MIS, which is, I think, about to be functional. We'll be able to get rid of that challenge. And then the measurement framework is still an alien to most of our district local governments. Yes, that not only to the district local governments, but to many people. They don't know how to track these indicators as by the Sustainable Development Goals. So we are faced with that. We've done a few trainings in a few districts, but remember we have over 100 districts, and I think we've done the activity in like 20 districts. So to many of these staff where the data comes from, it's still an alien. So that's why we call for support from different partners within this room and also out there to come and support us so that we popularize the measurement framework amongst the district local governments where we get the data from. Then the last one is no clear funding for data collection. My colleague Baka mentioned it earlier. She said, we want good data, want quality data, but no one puts us a budget to data, and yet, to data collection, and yet they expect to get quality data. So that's why we still have challenges of the authenticity, no thinking that maybe people just sit down, you've not facilitated them to go to the field to collect the data, but you want the data. So they'll just sit somewhere, fill it in maybe under a tree or in their office and send in the EHB form or send in the form 1 and form 2. So we still have that challenge of funding the data collection. I think this is the last slide. Our reference document, of course, with support from UNICEF, we're able to come up with a guide to monitoring of water and sanitation sector indicators, where we have all those definitions, the methodology and calculations. I know tomorrow we are going to go into the details of how we do the calculations, so allow me to leave it here. Thank you.
So we shouldn't expect her to keep us lively and awake, but I think she did very well.
Yes.
So thank you.
Very good.
I think so too.
Don't insist too much because she might move to the Ministry of Education to become a teacher.
Okay, we're going to do a joint reflection. So let's have just a second. Oh, Mr. Kayanja, please. We might also have somebody crossing from Ministry of Health to Education, as he also tries to emulate the teacher. But okay, we'll let him set up. Give him a minute or two to set up, and he's going to tell us.
No action as. Mother is awake.
Yeah, she did. Steven is going to tell us about the WASH NIS.
Can you kindly do sanitization?
Of course. Please, and I think it should be the one to give us that energy.
So kindly, they are going to stand up. Please stand up so that using someone goes in. So we are going to use the two hands here and then the lower limb, the two legs also. But we shall use this one 5 times. This one 5 times. This leg 5 times. This one 5 times. Then we count 4 times. 4, 3, 3, 2, 2, 1, and by the end of the day, we're going to see. And then it will be here. So I'll put down the mic. So are we ready? Yes. First mention. And I want also to hear the action. Okay. So we go 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4. Put in the speed. 1, 2, 3, 4. 1, 2, 3.
Yeah, it's really good. We need to remember that it's Ministry of Education and Sports.
Thank you. Stephen, are you ready?
Another emergency.
The more we have, the merrier. Thank you so much. Thank you, teacher Sanya.
I want to be in your class. I mean, when I was younger, and my cognitive abilities were high. Which subject? I don't have the subject. There are some teachers just go to their class. You just go to their class. I'll forget about the content and enjoy the teaching method. Okay. We are ready.
Can I project from your computer? I think there's just one example.
Oh, I need to share that.
I will share the comment. The 5 comments.
So this is the brief. The web-based monitoring system for WASH, which we call the WASH NIS. Next slide. So about this system, it's meant to support monitoring programs in WASH across the sector. Across various sectors, that is education, health, as well as the community. But also we want to have the one stop shop for WASH status in the country, right from the village to the district to the national level. But also we want to have the kind of information achievements on WASH. We want the issues of the WASH points, the investments and all that, so we want to look at that also. Then also we want to have the lowest framework for Uganda to report on SDG 6 achievements. We will also, using the same system, have a platform for partners to access the achievements. Remember, partners support so much WASH innovations across the country. And finally, we want to have a national competition for associated with rural areas, urban areas, and so on. So the system has a number of features. As I said earlier, it's now central, both with different ministries. Then we want to it has an element of looking at partners that are supporting us, supporting WASH, who they are, where they are working, what they are doing, and with what topics. Then, of course, it is secure. Not everyone can access it, so it is access it through localization. Then, of course, it is real time. How to build dashboards in form of graphs, tables, maps, and so on and so forth. And then dashboards aligned to SDG indicators for both urban and the rural divide. So 3 line ministries have used this system. Of course, we have Ministry of Health, we have Ministry of Water, Ministry of Agriculture and States.
The system is supposed to integrate already existing information systems for the three language districts. For example, in Ministry of Health, we have what we call the district health information software, which is part of the health management information system, as well as the training information system, which we call the DGs. Then, of course, we also support what an environment we have for release and the education, just like this just took us through. They have the release. Also, the system is supposed to be utilized by local governments at those different levels, and then also partners who are supporting local governments as well as the central government. Next. Service areas, when it comes to Ministry of Health, for us, we're tracking WASH, healthcare facilities, as well as sanitation at household level. Ministry of Water and Environment, they're interested in urban sanitation and issues of water supply, while Ministry of Water, Ministry of Education and Sports, they're interested in washing schools. Those are the different levels, service levels for JMP. Wash, on-prem work, healthcare facilities, and the lower one is for schools, water as well as households, self-managed, basic, limited, no service. Next. So far, we've had some achievements in regards to having this system running. One, on the side of the Ministry of Health, it has been integrated with the electronic health information system. So data from households is being collected, and we have successfully collected it in 20 districts. It's available in their data warehouse. But also the teams have dashboards which reflect some of this data in the selected districts. And it has given us a few points where we can look at our indicators of interest, access to basic sanitation, hand washing, basic hand washing, as well as issues of identification. We have also integrated the same system under the PHIS2, which is under review to capture wash in the facility. Yes. So, during the process of integrating this into the PHIS2, we came up with health unit wash total assessment tools, which we went through yesterday, aligned to the GMP non-term program. Then we also came up with the quarterly reporting tool. And this time around, we attached it to what we call the ICCM quarterly report. That is HNIS 97B, to ensure our team reporting. Because in the past, we had a WASH report which was separate. So people were not cooperating. This time around, as the quarterly report comes in, it must come on what? The WASH in healthcare facilities data. Otherwise, it will be complete reporting. With support from UNICEF still, we have hired another consultant. We know the first consultant developed it, but partially, they don't work partially. So another consultant is on board. So the roles of the consultants is one, develop dashboards for end user database. We want the people who wish to use the system to have with the data. Then, of course, it's supposed to develop technical user manuals And then it's supposed to support the operationalization of the system that is built industrial for central and local government staff, the use of the system. Next. So our next steps, we hope that there will be complete operation of the system, of the system with different systems of the line ministries, especially that of the Ministry of Water, Environment, as well as that of Education. We saw that of Education is not yet aligned if people observe it's not yet aligned to the GMP requirements. Then development of both technical and governments. Then the first rollout to local governments and partners and upstream and utilization. That is a snapshot for the eaches. Of course, this is still work in progress. But look at the quality of graphs. Probably we don't have data and state graphs, but at least it gives us a rough picture of how the things are happening. Next. So was that man known as more? If you say without big data, you are blind and deaf to need a It's true. So many of us were here saying, why do we have all these situations? Why do we have? So without data, you can make from this people that you're working. Neither can you from this people to give you more money. Next. So those are the partners we are having for now. UNICEF has been the main partner supporting us in having this system established. Of course, we have many people who are supporting the issues as well as owner, and they're supporting the integrating of these systems. Thank you very much.
Okay, we're coming back here. We still have some members online. South Kenya.
We are having Helen and Diana.
Only Helen and Diana. Diana being present with us here.
Yes.
So we have only Helen. I usually want to make sure that we are not forgetting our colleagues who are online. So I hope that Helen is following. And Helen, if you have any comments, please feel free to use the chat, and we'll be happy to share your insights with everybody in the room. So we're now back to the country level. Yeah, we have been at the global level, Tuesday, Wednesday, and half of Thursday. Now we are back to the national level. And we've heard from Ministry of Water and Ministry of Health about the frameworks that they are applying. Not so. So we now need to start reflecting, because all along we've been asking questions of where is the data? Where is the national data? Why isn't it reflecting in the global frameworks? Is it that we don't have data? Is it that we're not collecting it? Is it that we don't have our own indicators? We have seen and heard. We actually have national frameworks, and data is actually being collected. We now need to start reflecting on where is the point of convergence, point of intersection. And we need to start thinking of the alignment that we have been expressing a desire for since we started the discussions in this room. So let's have a reflection on what we have just heard from Kate and from Mr. Kayanja. And as we are reflecting, let's have it at the back of our minds that we are looking for alignment, we are looking for the visibility of national data at higher levels. We are looking for a place where Uganda or Ugandan data can be seen and applied. Okay, so reflections.
Yeah, thank you very much. You have told us to reflect. I'm reflecting on the data collected for hand washing. Kate's presentation is saying proportion of people using hand washing facility. So when I'm reflecting, is it using or having hand washing facilities? So which data is being collected? Because using is to do with behavior. Then having is to do with access. Okay, you can elaborate on that.
And Rafa will come to me with a microphone. I might have it up on it.
Thank you, Kate, for this elaborate presentation. Mine is the book reports for this. In our practice, I realized that we've established these good monitoring frameworks, but my challenge has been the meeting point between the data for government and the non-government actors, and in this case, in you will agree with me that we have a lot of non-government actors or stakeholders who are doing equally a lot in WASH. Maybe the challenge is that they may not be implementing across the whole country, but believe me, where they are, the impact is felt. And sometimes they have choices of moving from this area to another, which is also good. But when you try to and say let's align and see how are we moving together in regard to these indicators. If I am AMREF or if I am IRC, can I measure myself against any of these indicators and align my activities in that regard? And at that point, where do we have the convergence? If I went to UWASMET right now, can I have a picture of all these NGOs doing this much, contributing to this indicator in this way? And at the end of the day, we can have a meeting point with government interventions in relation to these different specific indicators. I don't know, what do the rest think? How best can we have that kind of alignment?
Yeah, thank you, Ken. I'm still again for the presentations around WASH data, as well as the tools. Now, Ken did raise the challenge. It's paper-based collection being a very big challenge we are facing. And then she also highlighted that WASH MIS problem is set to address this challenge. So I was trying to think, is the WASH MIS going to engage PhDs using phones or something related to that to collect data so that we have real-time data? I want to maybe just to understand more about it.
I can speak. Thank you. So we have talked about three systems here. Those online. We've talked about three systems here. We have the EMIS,
Okay, two, we have the WASH MIS. And I think for me, the action should be, how do we ensure that there is an interlinkage between the EMIS and the WASH MIS? That's one thing that we need to look at. But again, the action we need to have here, for those who recall, we were here with my colleague Wandera, and we decided to go into the water.com data and realized that I think JMP used the EMIS data in 2011. 2011, we are in 2024. My question is, what action have we had? Because this, when you look at the EMIS, I believe it's an authentic data point source. What is it that we need to do to revitalize it? You know, the Ministry of Education has very well structured structures. And I was really a little bit not well when I see it's not updated and you have the inspector of schools. You know, look, the structures are very clear of how data can really flow. So when the roadblock that the EMIS, before even we say, we start going to government and say, you are underfunding washing schools. What have you done to show evidence that there is underfunding of washing schools? In 2011. So those are the things to really think about. So the interlinkage is important, and then how do we ensure that we revitalize the system to be in place, and how well are they aligned to the GLAAS, JMP? Because when you look at the washing schools they presented, when you look at the indicators, they're around 7. Not really very complex, I should say. So we need an action around there, because the hope coming here is reflecting on action. Where are the bottlenecks? How do we, where, like, you know, there was a big meeting last year when we were talking about the progress on SDG 6, and one of the bottlenecks they said was around data quality and data protection. It's again coming back and some issues. So we better address it than meeting every parliament about it. I'm not government, I'll say I pray to submit, but that is it.
Maybe I also give the next person. I was looking at the aspect of coordination around that. I know we have so many engagements that bring the entire wash sector together, but how can we deliberately focus on having such engagements, but looking at how we can have that which is coordinated? I know we're talking of systems that can be merged and all that, but can we have, and that can be a person, can be an entity, but that kind of figure that does the coordination bit of it, to ensure that by the time the data maybe is being submitted outside the country, it is.
Well, listening to data coming from 3 different sectors. Both questions, but gives answers in one way or another. We have what we are calling the program approach, which brings together water, supply and sanitation, education, and health as a program. Well, it is still dragging behind. But when you think about it here, it's a reflection. Don't you think it will give us a better way forward? going the programmatic way and amalgamating all these data systems into one. And now it becomes Glasgow and plus JAMA, sorry, that one, program approach. You know, so that we find a way to bring all these things together. Of course, every individual entity will want to present its data differently for its reasons, you know. But I think as we are here reflecting, we also need to reflect, or even to the development, the NGO world, the development partners here, how, well, we want to come back for a workshop that talks about how we integrate these three systems. I'm seeing people's senses changing a bit, but I think that's where we need to go. That at no time do we have three different presentations talking about the same data, but in different institutions. Maybe what for people can champion that you don't have, you have one center where you get to wash data on schools, on hospitals, and then on water supply, all put together in one house. Or UNICEF can also champion that. So it's just a food for thought as we are reflecting to see how we amalgamate this data and actually make good use of it. Getting it to the right people, channeling it to the right people, for the right reasons we are collecting the data, you know, and for the better improvement down. Because we've been shooting GLAAS to give us the high-end information. Now probably we'll ask us a question, how are we using our information? So it's even nodding. So it also goes back to us. How, and it will be a take home for us, how do we package this information? How do we get this data together to answer our questions? But also as a take home from this meeting, that this was, like Jen was saying, we have, what are those parties that we signed to, so that we also sign an agreement here as experts in the WASH sector, that we are going to amalgamate our data. Thank you.
I have one very specific question to Kate and then a short reflection. You presented the indicators which came from the guideline, and I noticed you presented 1 to 6 and then, what was it, 12 to 14 or so. But the few are missing that we discussed earlier, like the non-revenue water, customer satisfaction, financial sustainability, per capita investment costs, drinking water quality and hand washing facilities in schools, and wastewater treatments. I'm wondering, is there another department within the Ministry of Water and Environment having those data, and they should also be here and talking about what they are tracking? So that's one question. On the reflection is you talk about 3 different data sources. I think there's even more. I mean, don't forget UBOS. I think all household surveys out there certainly be considered what information is there or and collected and could and should be integrated. Thank you.
Thank you. I'm jumping right away on the same type of question. This is really good. You already have something that is quite good. Bravo, and I understand that it was developed with support from UNICEF. So bravo for the work on this guide. A guide can always be improved. But I had a question. There are 3 indicators on planets. Is it in the report? It is. Okay, that's perfect. And I think I have some other comments and suggestions, but it's not time to do that.
Can I say something before it goes to you about the report?
Yeah. Okay.
I'm interjecting about the report. We have a complete report. But it's featured in the annual performance report of the natural resources, environment, and the climate change program. Please take note that WASH falls under the human capital development program. But in there, WASH does not feature prominently given the other issues that the human capital development deals with. So the WASH report in the HCD is really small, but the detailed report features the contribution of the Natural Resources Environment and Climate Change program to the other programs. Why? Because WASH is largely a Ministry of Water and Environment and Ministry of Health issue, but Ministry of Water is not the program lead of that program. Do you understand what I'm saying? I can say it again. So that report is available, and there is a whole chapter that has a detailed WASH report.
That's a program performance report 2023.
Yes.
From natural resource, environment, climate change, land and water management. That's the one.
In there, you will find a whole chapter with WASH, and that WASH report is in there.
Oh, great. Thanks.
Thank you. Thanks. Oh.
Thank you so much. In my reflection, saying that my observations on the presentation so far is that the well-established system very important as on the SDG 6. But however, in all these presentations, I have really noticed that there are multiple or multiplicity of monitoring systems in the various levels as under WASH performance measurements framework that has been just elaborated to us. My understanding therefore for the reason is that there is still too much difference as we can see. For example, under health management information systems and the water management information systems, as has been provided here. However, I have also observed that there is strong management information systems, which has been based on the ladders, the monitoring as provided for under GMP, and those areas of self-managed water, the unimproved, and also there were cases under school, I think, where it was mentioned the presence of hand washing, but without soap and water. So those to me are important reflections. However, I have not had in any of these presentations issues concerning the environmental workers and the extension staff. So under WASH, I believe those also will provide so much input on data collection. Thank you.
Yeah, thank you very much. I want to concur with the previous reflectors that we have a great deal of data that we are picking, and at least we have systems set to monitor. However, I also want to just mention that it is good for us to have a several sources of data. For one reason being, we need to be able to triangulate and see how much the data we are producing. And on that background, also, I'm not Kate mentioned in the presentation that one of the challenges that our ministry is facing is they're using the paper-based system. And Ivan also mentioned earlier that there is need for some kind of integration and perhaps alignment between government and then the CSOs. Now, the CSOs have come up with the rural urban water management information system. We have rules, and through this system, they have been moving around around 12 districts now, and doing a census for wells using pond line, pond two, and with the results of Brumis, we have been able to see a lot of data discrepancies. For example, in Kabale, a couple of districts in southwestern Uganda recently, where Brumis was conducted, we found that around slightly over 1,000 wells or 1,000 water points were not mapped in the government or the ministries or water atlas, which means, you know, if we are picking data from the water atlas system, we need to be very accurate among this. So I'm just thinking that that integration with other sources of data would really be helpful, because I think there's a lot of information that currently the water atlas doesn't cover. I remember in Tiana, after having invested there for several years and seeing no change in the water coverage levels in the water atlas, we were worried and decided to sit down with the water officer, our CSOs, and we tried to come up with a district level platform for verification of the data that the water data that we collect on the quarterly basis. So whenever we had these district water and sanitation sector commission committee meetings, we would reserve some time to report and say, you know, we have perhaps repaired this number of water points, or we have repaired this number of water committees. Just some kind of data verification validation, and that way I think that's what I want to propose. Thank you.
You submitted.
Okay, thank you very much for all these reflections, and I think we're all going in the same direction. We're looking for that point of convergence. We acknowledge that a lot of work is being done currently using the tools and frameworks at our disposal. All ministries, all CSOs, all DPs are doing one job or another. And I think this is one idea, one statement that has been coming through all our discussions. We are doing a lot of work, but it is scattered. Even when things are so obviously similar, we seem not yet to get to that point of sitting at the same table to enjoy those similar dishes. What is it that we must do? Because coming over to Ginger, I was from that need, you know, the need to align. Much as the title of the concept note is about JMP and GLAAS, but there is no way we can align at the global level without alignment at the local level, because it all starts here. So even if we have all these tools that have been designed by GLAAS, by the data that gets there comes from the lowest level possible. You know, so what is it that we must do? Somebody's itching.
Sorry. No, it's very good what you're saying. I completely agree. There is one little thing that I would like to suggest. At country level, it's more than an alignment that you need. You need harmonization. Harmonization means when you use a term, the definition of that term is the same across all ministries, and that's very, very important. Now, when you prepare that, the alignment with, and I remember we need to also align with the regional level in Africa with AMCAL. This is going to be important. And you need to align with the JMP, the GLAAS, whatever exists at global level. So we speak the same thing. It doesn't mean that you have to use exactly or only what JMP is saying. For example, you can go further, have more indicators, more specific indicators that respond to the policy needs at national level, but you need to be able to calculate, or we need to be able to have reporting for the national needs, for the regional needs, and for the global needs in a coherent manner. That's what I wanted to suggest. Thank you.
Yeah, that's one suggestion. Harmonization. Is that all we need to harmonize definitions or terms? No. Okay, what more do we need to do? We've talked about alignment, we've talked about harmonization. What else can we talk about? Okay. Yes, I want to ask you. Some questions?
There are some questions which were asked, and I will respond. Thank you. I will not take the bullet alone. We are quite a number from the Ministry of Water and Environment. Attempt to respond to a few. Then we have colleagues from Urban Water. They'll also attempt to do some. And then the rest, I think we'll go to Mr. Kayanja about the WASH MIS. Wilberforce asked about washing indicator. Do we measure practice or function? So, like I said in the presentation, hand washing is a behavior. So when it's like that, it becomes a proxy indicator. What we always look at is it's having a hand washing facility at site with water and soap. So that's what we take. We will not go into detail to see who washed your hands, because we will not be there to observe all the time. So we take it as a proxy indicator. Once it's there, and the availability means there's water and soap, then we shall take that. We will have a hand washing facility. And we presume that you are washing hands with soap. So we take that. The second one, I think I'll leave it to Martha to answer it. The coordination around data, I think that is a food for thought, but we believe with having the WASH MIS, where we have the malvention of combining of all the three MIS systems, that is for Ministry of Health, Ministry of Education, and Ministry of Water and Environment, to be able to get that uniformity and get the actual data out. The rest, Martin, you want to add on? There was something about
Maybe I want to speak to the issue of the water supply database, where one of our colleagues said that there were some sources that were missing in the exercise of the bit in the Rwenzori region. I want to say that the system is dynamic, and as Minister of Water, we continue updating the system. So there could be some sources that we missed out, but we continue to capture those sources, and eventually we'll be there. Yeah. But I also want to add my voice on Kate, where she says that we are at a level where we're handling the issue of integration. Like our colleague Kayanja said, we're having WEMIS, we're having IMIS, and then we have the database under Ministry of Health. So it's a good case here. There's something more. We're going to have an integrated system where we'll have all our reporting unified, and then we have the certificates. So we thank you.
Excellent.
Some of them. Thank you so much. Thank you all who have made your contributions and asked questions. We are really delighted by the interest. I want to say the following things before I answer your question. One, the government is very much aware of the state of affairs. We are not happy with it, but we also want to appreciate that we are not where we used to be, although we are not yet where we want to be. We are steadily moving, and with steady progress, we shall get there. Now, that's what's happening. So we want to make all of you, our partners, feel comfortable. The government is still in charge. Government is still in charge. We are aware of the problems and we are working towards solving them. Yeah. I want to speak about the partners. That question has touched partners and how they align and how their constitution is captured. The person who asked was of the view that we need to have the data collected at your state level. But I want to say that the role of these and popularizing these indicators and the framework and everybody is to allow all of us to have a common understanding. When we highlighted the objectives of this meeting, we spoke to creating awareness, we spoke to harmonization, we spoke to localization, contextualization, alignment, all those things we want to achieve. We may not achieve everything in this meeting, but we are having the conversations in all those directions. So we want also to inform programming, both at government level and also the level of non-state actors. There are partners here who want to implement WASH in your respective areas of jurisdiction. Because you know what we want to count and what will be counted, then it should inform the programming. What do we want to do out there that is going to add value, that is going to make a contribution to basic water, basic sanitation? We, for example, do not want to continue implementing point processes if we can do otherwise, as we get towards our target of safely managed water on the premises. So that informs our programming. That's one. Two, I want to believe also that partners do not operate in a vacuum. They work actually in local governments. That's our point of intervention. That's the place where actions really happen. In the district, in the municipality, in that urban authority, wherever we are working as partners, but also as government. So it is upon us that as we support those districts, those cities, those town councils, those whatever we work with, to have our plans integrated, our budgets integrated, our reports integrated, so that our contribution is captured. I think as partners, we need to be very interested in that, so that when we receive a district report, a municipality report, a city report, as ministry, your contribution is captured in there, and it is not lost in the dust. So we need the partners to be aware of that, so that you need to demand it of the district, and not sit back when the districts are not reporting and say, your government. It is your thing also, because your work is in there and it's getting lost in the dust. So we want to have that taken care of at that level, but also your WASNET. When we keep hiding away from your WASNET as partners, we are doing ourselves a disservice. We need to get in there and get coordinated, because government listens to your WASNET. Your WASNET is the coordination body of CSOs in WASH on behalf of government. When they speak about CSO affairs to government, government listens. So that's our point of coordination. That's our point of convergence. Let us make use of it and not work to undermine it by operating separately. I think I want to stop with that. Thank you. Okay, just a rejoinder to Manda.
if you look at the annual program performance report, under the coordination, which is WASNET, we have a whole chapter talking about CSO's contribution to WASH and even CSO's contribution to environment. So it's not in isolation. Once you're isolated, then you know you're not coordinated. You're not under the coordination act. Thank you.
Yes. I know I'm going to speak this as a CSO, but I've been in different forums. And one of the things CSOs do, we want to show government. Show government in the sense that you want to show that you're making a lot of contribution, yet you didn't engage in the planning. Which has been there for so many years, and it really happens. Because when you look at what CSO contribute under a WASP, you have to also all this huge amount of money. So as we are saying, we need coordination. That area we need to strengthen right from the onset. If I'm having a 1 billion budget in the end, I should declare that right from them, so that it fits and it's reported. Then us again reporting in a parallel way the other side. So how does it? So that's why it's the line off that different line. So we need to change our dynamics a bit.
Are you starting praying on baby?
Thank you so much. I'm trying to add on the voice of Ministry of Water.
Yes.
When we do development and implementation of piped water supply systems, there are processes which are captured as process indicators. So when we are reporting at that lowest level, the implementer in Kayunga, the implement fix the nitty-gritties as process indicators to communicate upwards, which are aggregated into other bigger indicators. For example, we cannot declare a piped water supply system done if ESS was not recognized, which is environment. We cannot declare a piped water supply system done if environmental social planning management is not part of it. And the moment we are going to declare a water supply system done, we do an environmental audit. All that is indicating that we did environment and we are trying to track back what we did during the implementation of these water supply systems, both in urban and rural. Two, we talked about indicators that we didn't know. These indicators are quite many. I'll just be very brief, maybe just point 1 or 2. Functionality. When we talk about functionality, we are looking at the number of days when the network is giving water versus the total number of days in a year, which is 365. The percentage of that gives us the functionality. Non-revenue water is percentage of water billed versus the produced amount of water. What is the percentage of the water billed versus the percentage of the water that is produced? It is calculated still, the calculation we shall do. Financial sustainability looks at when we manage a piped water supply system or any water supply system. When we put out this service, what is the cost of managing this service versus the total revenue within this piped water supply system? Most of these indicators that contribute to the mandate of the Ministry of Water of functionality and sustainability are done at different levels. Piped water supply system on a scheme, you will find non-revenue water done at that level. Then when we talk about the region, in the region we have 6 umbrellas.
So you'll find we shall also compute the amount of non-revenue water per region. What has Karamoja, how has Karamoja performed in as far as non-revenue water is done? So we analyze at the scheme level, we analyze at the regional level, but also these regions, after computing their different non-revenue water, which is also another indicator, they will send this information the way Kathy presented to the headquarters in New Zealand, and then a national level will be computed. And this is what we will see also in the annual progress report. Something that was not talked about, I think my brother here will talk about it, that is management. Management has two areas where it will emphasize. Originally, it was done in another way, but during the transition of bringing on board umbrella organizations, because now when you look at the management of this umbrella organization, the board is now regional. Yet, the board before was a scheme. So you will find the scheme is managing its own entity, but the development was very slow and very low. So during the improvement of the composition of the umbrellas, then the board became regional. So you will find that there are 6 boards based on the region with composition. Some of these members are umbrella members, local government members, and others are ministry members that compose that board, which sits every 3 months and which have annual progress performance review gatherings to look at their performances. And finally, I can also, the management will bring it, you draw more light. Then I can talk about finally the per capita investment. When we talk about per capita investment, it has a range based on different respective financiers. It ranges from $75. It can be below $75 per person, or it can go up to $120. It can also go beyond. How does it go beyond? You will find that, for example, Nakapiripirit municipal council, and the law says for you to become a municipal council or the town council, you must have a water supply system. I don't want people to quote because they are those that don't have, but as far as we are concerned, it must have a water supply system to qualify to become a town council. That's the concern of Ministry of Water and Environment. So if Nakapiripirit has to be given water because it's a municipality or a town council, you will find that the population is a little low. But the law says everyone must get water. It is a constitutional right, and we also implement based on that guide. So when the population is low, you will find that the per capita investment goes beyond the 120. With donors and financiers, there are steps you go through when you are doing the approval where the per capita investment is beyond 120. So it is the number, the amount of money you inject in a water supply system versus divided by the design population. What population is going to be served in another 20 years? Because the lifespan of this water supply system is 20 years. So within 20 years, what is the design population? And that design population is one of the key parameters you will find in a completed technical engineering design of a pipe water supply system. So you use those 2 parameters to determine the per capita investment, which report you will always find in the annual progress report. So there is a lot of breakdown that has happened when you read HCD reports. For example, when you talk about upgrades of piped water supply system in large towns, you are now contributing to functionality. When you talk about, we talk about rehabilitation of piped water supply system in small towns,
you are also contributing to functionality. So you'll find a number of breakdown we are looking at. When you talk about people's large management plans in small towns, the specificity has also come targeting industrial parks. This one is an indicator as well as an answer to directing. So you'll find this one under that, but still everything you'll see under HCD, you'll find it in the annual progress report. In a nutshell, those are some of the indicators we have not talked about. But you also find that HCD now picked the environment to be very independent, that they even included a catchment and water source protection measures in rural and urban areas. So APPR will give you specific results after picking data on environment where we can have source protection or catchment protection.
Well, I mean, there are more indicators coming up. I don't know where these indicators have been hiding over the last 3 days, but we have a lot of work to do. Let me just give a sun has been burning.
Yeah, to do something
But keep it short so that we take it from there.
Mine is very short. For me, I'm excited and pleased that this conversation is taking place now, because it comes just at a time when the sanitation policy is being developed. Perhaps within the policy there will be a chapter on data, because we all realize how important data is when it comes to implementing the sanitation watch. So I think it's timely. I think the person writing that and the lead ministries taking lead in saying let's have all data one stop center so that we can clearly align nationally and also internationally.
Thank you. We appreciate compliments.
Thank you so much, and thanks to the team. All the presenters today, I liked the teacher. It drove me a number of years back to the classroom, and I really liked it. I also want to thank my colleagues and the presentation. I think one, I will make quick comments and supplements. We need to underscore and interest ourselves in appreciating what water utility regulation department does. There is what they call a performance contract, and that framework governs performance management of people who are involved in water supply and sanitation service provision across rural and urban. In the rural, for us to move further, there are initiatives to look at what is that appropriate framework for operation and management of rural water supply, infrastructure, and service. And that also gives in an opportunity for us to regulate. And that now looks at the O&M framework, which Katie has already mentioned, where we are looking at the area service providers, the hand pump, and how they track information for us. Very important in this case is we need to focus more on water quality for rural water supply systems. If we are going to say safely managed and we don't address water quality for rural water supply systems and sources, then there is a problem. That is an area, because the country is huge, we largely rely on the district water officer to give us information on that. but it is an area where we need more strengthening. The data generation mechanism needs to be strengthened. I want to call upon government partners here. You know, collecting this data is a tedious process. We need to incentivize data collection. That is very key. And now when you tell government that incentivize data collection, yeah, you're squeezing blood out of what? But these are big areas, entry points for government partners for us to really come up with quality data. My colleague mentioned about functionality. And functionality is an area where we need to strengthen it. Because functionality has a combination of other indicators. And these other underlying indicators contribute to safely management. Yeah. So which are some of these? You can't say you have not addressed the quality indicator and you're talking about safely management. But as you address the quality indicator, what parameters are you focusing on? There are bacteriological ones, there are physiological ones, but we also have the qualitative indicators where we are looking at the color, the acidity of the water, the smell of the water. Those are qualitative ones which can always be assessed during inspections. So those are very key. Then, as we also talk about safely management, there is an element of hours of service. Now, this is where we are doing when we get to utilities and how they are measuring hours of water supply, they will clearly tell you. Speaking from a regulation perspective, I was questioning how you can have 18 hours of service, report that this year, following year, you're reporting the same and the other. They told me, you know, the truth is, for this one, we do not have clear structures of how we can measure it. So we just put that value of 18 what? 18%. But simply, we are looking at our denominator as the whole year. We can even change it to 90 days in a quarter. We can change it to a day. But you're looking at the number of days, number of hours of no water supply over your denominator within that period. If it is in a day, if you don't have water for 12 hours, it will be 12 hours out of 24 hours in a day. You can triangulate that to either 360 days. You can choose to put that to a month. So whichever period you want, you're able to actually do what? Triangulate that. But how do you collect that data? It requires you to have proper records kept either electronically or manually. And this is the data you now look at and do the assessment. I want to invite you. These are some of the areas where we think as leaders, we need to be strengthened more. But you can't come directly to us, but if you strengthen our utilities, yeah, the umbrellas, national water in that direction, then the data quality, that's what? That's my colleague talked about management. We're talking about management, private operators and the like. I think gradually the sector has moved and got to a different level. We previously had a number of management models. We used to have over 1,001 water supply systems, and each of these had what we call a performance agreement. So you had to run 1,001 towns to request for their performance report, and people were about to run mad. So we looked at a model where these are in a utility kind of what? Arrangement. In the previous arrangement, we would require that if you're a private operator, then you should have a scheme operator, and the scheme operator should have a management contract. Yeah. Then under the management contract, you expect to have a water board, you expect to have a water user committee. Very critical and provided for by the Water Act. Now, what is happening right now, we have a utility model where umbrellas based in the regions are managing a number of water supply systems. Now, it is an internal management approach for the umbrellas to choose who is running for them and reporting to them. So for us, when we go, we want to talk to umbrella. We have given you 100 water supply systems. How are you performing? We do not want to micromanage. So some of those indicators now become redundant at our level, at sector level, but very important operational level. I want to address myself on sanitation, and this is a contentious point with my colleagues. We had clearly, Ministry of Health is talking about household hygiene and sanitation, sanitation in healthcare facilities. We have seen sanitation in schools. Now, as ministry, we need development partners to come in and strengthen us and appreciate the focal pivotal role that utilities play in addressing sanitation service provision across the sanitation service chain. We want to address ourselves on appropriate containment facilities, the role of households, the role of institutions. Where do they get resources? Can we incentivize them to be able to have appropriate containment facilities that are emptyable? Government should also come in, incentivize private sector to invest in transportation and emptying. Because this requires a heavy investment, private sector is less attracted to it because of the returns, a longer period of return to what? To investment. People usually want 2 years, 5 years, but it requires a long period to raise your initial investment. So many people run out. That's very critical. As we do that, can we address compliance to standards across the service chain? Are we looking at the sanitation safety plans across the chain? Are they being complied to? If we are looking at treatment and reuse, are we looking at the standards of influence? Are our treatment plans meeting that? So that's very critical, and we should be able to access this information through the utilities, and we should be able to report on that. And when you look at the sanitation, the JMP sanitation indicator ladder, it's very clear and explicit. But how do we really get there? I think a lot more is required for us as a sector to try and strengthen. Not that the information is not there, but how do we capture that information, organize that information, and be able to report on that information. Colleagues, there is quite a lot we can share because this is an area that really attracts my intervention. I don't want to spend much time. Let me end there for now, but we can have close conversations as we move on.
Thank you. Mr. Kaya, I still have an opportunity to respond. We have really gone around and some questions really was your presentation. So to share what insights have popped up since the presentation and the reflections. Thank you.
Thank you. But I thought I had everything I had. Because from the communication of groups, I think most of the things most importantly, Martha said that CS should trust that we will do this. Because we've already seen that we are out. So trust us that we can do the work. What we need from you is operation access. technical support, it enhances, then you can together do the work. That's what it is. Thank you.
Please come forward. We're trying to wind up. I see several indicators have been hiding. They are coming. Indicators about functionality, about management, about sanitation chain. All those indicators are coming up. And we need to find a way of fitting them into this harmonized framework that we are looking for. The other point that's coming through is about CSOs. CSOs have the platform through WhatsApp. We have encouraged them to not shop it, but make sure they report through WhatsApp. Will that be the end of our lack of harmonization?
Thank you. Just let me comments. One, both ministries are reliable outside. Okay, two. One, both ministries reliable outside. Electoral deals. The ministry of health transport ministries in events for industries. So we are working on registering all the DHs so that we can start attaching these refreshers, compensation, coordination to people who are previous challenge. Yes, that is. Since we are then often it's important to have the legalize starts from just we have had use cases for quality of information system immunization that I think watch colleagues could leave for job for digital micro planning. Because we capture body so the households with the apartment, we are able to have very fine micro plans for enforcement and planning by about 100 by 100 meter radius. So for like for 0 dose children, for such and such. And the data that has been collected for WASH within the quality of information system has barely been used. And one of the hardest challenges is how to improve data that is not. So I think it's important that we just also be using this big data, but it's at a very micro level because it's at each household. So we are looking for this. Thank you.
That's an opportunity. Thank you very much for sharing.
Thank you very much. I also wanted to support, but first of all, want to Martha submitted already. I think that was a great point about us as well. We like to work on the silos and sometimes we miss that opportunity. So my reflection is that if you build structures that require compliance, submit this data, I think it will be very easy. We may still go back and report. And what I was thinking about is that we do make reports to I think the NGO, financial reports. How can we have a conversation with them so that we also have, they can also require from NGOs working in mind, also submit such I think if you can build the structure in the system, that would be there.
Okay. Interesting suggestions coming in at Santa 4 and okay. Suggestions about compliance, suggestions about okay, I'll call them out. I think this is something needs to be taken. There are 2 points that I think we need to delve into tomorrow. The trust, the confidence that government will give us this leadership. Because we are looking for that leadership. And we have been reminded that government is in charge and government has the capability. And therefore we should trust government to take leadership on the matter of bringing all this data together, harmonizing it, and making sure that it not only speaks to the lowest possible level, but also to the global level. 2, CSOs. CSOs must stop shopping for surprising government with their billions.
in their report, in the reports, you know, you should already demonstrate or show what you are capable of at the point of planning. You know, you don't wake up at the end of the financial year and to show us that you actually had very many billions. Right? We could have made better use of those billions if you had told us that they were available. But here is not that. Okay. So we're trying to, you know, bring the points that are coming to our reflections to the tip of the panel. Tomorrow, before we wind up, we have to answer all these questions. We really need to get out of here with some really, contented that we are all going to commit to work towards one set of indicators, one way or another. Because we are the ones who tire ourselves out when we are running all over the place, reporting on different platforms, to different donors, on different tools. It wears us out. So we need to find a way of making this work, and we need to identify at least as another key outcome from here, then identify that one-stop center. Yes, where all this would feed into, including all the indicators that we had previously not drummed up over the past 2 days. Now we know there are indicators on management, on on the detail that goes up to functionality. So we have to think about them, how we're going to be able to incorporate them on a single or at least a harmonized place, agree on definitions, agree on methodology, and then we move forward together. Because I think we're coming to the realization that sometimes we are running around with this chicken, chasing the same data, but chasing it on different fronts. I think this must stop. Well, our tea is ready, but the teacher, I think, wants to have the last one.
Yes.
I'll let you.
Thank you so much. I'm looking at those views that you have been suggesting as one of the running so far that we have to take. And indeed, earlier before we presented, we had a number of indicators not tackled. But now within this interface, we find that there are indicators which are very salient and they are landing in when we had not thought about them. So one of the issues that I'm thinking about is strengthening monitoring, and this will be joint, because my brother has mentioned things in management, but I'm sure you have not even reached there to see what they do. And equally what he gave. Now, what he gave also goes beyond the parish development model. It even reaches there. But you find that even those colleagues who are not represented here, and yet what we are discussing would benefit them. There is an indicator on WASH, or the one we call empty. I've not heard anyone talk about empty the facilities, and yet we eat, use them, and they remain unused and empty. That indicator is very key there. But also I want to say that now we have reached a point of involvement in the task force. The task force would coordinate what's going to be now joint to develop that framework. We may not wait for everyone to be here, but we can have that task force to coordinate us, and then we are informed from time to time. I'm happy I heard you mention that people bring money on evaluation. On evaluation, people bring hands and they say, now we had these billions of money, so we are coming with this for invalidate. Then you ask yourself, when did they do this? When this one happened? And then at the end of the day, we expect to read a prayer that now, because of what we have had, our prayer is you approve this. You know, those are the issues which we need now to get for at planning level before we reach the point. So with that, I wanted also to request you, am I free to go to Kampala so that I can come back tomorrow? Thank you.
Please don't go back to Kampala. This workshop ends tomorrow. And that's why I said first to everyone who was considering going back to Kampala. So please don't go back. Enjoy Ginger. Don't go back to Kampala. Just stay. Don't ban fuel. Don't ban fuel. I want to thank you all for your contributions. We are compiling these concerns and suggestions before we go home tomorrow. We have come to a point where we know the way forward on this matter. So thank you so much, everybody, for your contributions. It's been a long-ish day, but I hope that you enjoyed it. Please have some tea. Don't leave any cup standing, and don't leave water on the tables. It is paid for, it is ours. If you cannot have it now, put it in your car. Don't have a very nice evening. Let's try to start on time tomorrow so that we end on time and be able to find the road for the weekend.
Yeah.